down the roster and answer here or do something to let us know. Sandra.
Here.
Robin. Gary. Gary Henson.
Gary, can you hear us online? I think you are muted, Gary.
We'll go on, hopefully. Let's see, Lori, I think she's going to join us here. Monica.
Good morning.
Good morning. Thanks for joining. Sarah. Mike.
Here.
That's Mike Brower. Mike Kagi. We never did hear from him. Keith and Jason.
Here.
Jason, this is your second, okay. Thanks to all of the staff. Thanks to Sunflower for doing all the hard work and preparing. I know Krista and Brandon especially. This big old stack of papers we got here is thanks to them, and there's a lot of good information in there, and we'll disseminate that as we go along. Welcome to our guests in the audience, and just FYI, we're still polling on the next meeting. I think we'll talk about that at the end. I think the next meeting we have kind of nailed down, but as far as a set meeting time, we've got some data. I think it was the second Friday that appeared to work for most people, but we'll discuss that as we get going. So call the meeting to order, and our first item for today is the approval of the minutes. If everyone's had a chance to look at those, I'd entertain a motion for passage. First and second, Sarah and Robin. And any further discussion? All in favor, aye. Opposed,
Aye.
same sign. Unanimous. Our next item is update and comments from the Attorney General's office, and I'll turn to Chris for that.
Thank you. Chair, I think I will just combine points 3 and 4, if that's
Yes,
okay.
Please do.
So just as brief comments from the AG's office, we are currently going through our transition to a new administration. So if things are a little delayed in responses, if anybody in the public or anybody on the board is reaching out to us, just know that that might be part of why we are a little delayed. But we do have some good news. Since the last time we met, we have announced multiple new settlements with different defendants. Those are CVS, Walgreens, Walmart, Teva, and Allergan. That will, as you'll see in a proposed budget, bring our projected total, assuming everything maximally comes into the state, in the neighborhood of about $340 million for the state over a period of about still 18 years. So that's pretty exciting. Those settlements are going to be, we wouldn't anticipate any funds flowing from those new settlements until at the earliest Q3 of 2023. I would anticipate it'll be like the previous round of settlements will be closer to Q4. But just know that there are new monies that are going to be coming into the Kansas Fights Addiction Fund. Additionally, we are working on the current round of municipal distributions. Those distributions, I sent out an email this morning. This is not something you need to review deeply. It's just for your own information, but it is the distributions that the cities and counties are going to receive. These distributions are direct allocations to participating cities and counties, and what we mean by Participating cities and counties are the ones who decided to participate in our settlement process. So these are direct payments to them for abatement purposes. It's essentially the same purposes that we are limited to under the Kansas Fights Addiction Act for the KFAF dollars. It's the same limitations for the MFAF dollars, but this just gives some participating cities and counties a little direct control over some of the funds. What you'll note if you take a look at that chart is that a lot of these cities and counties are not receiving substantial amounts of money. It is in the scope of hundreds or thousands of dollars per distribution rather than in the tens or hundreds of thousands of dollars. The largest populations will receive a considerable amount of money, but the vast majority of the cities and counties aren't receiving money that can immediately shift the opioid crisis in those communities. It's things that can help, but not massive amounts of money. The way these distributions work, if you remember from our first board meeting, and Jason, I know that you weren't here for that meeting, the way these monies will work is that every time we get a distribution at the state level, we will do a distribution to the cities and counties using these charts to make those distributions happen. We had anticipated getting this distribution out before the end of the year. There were a couple things that held things up on our end in the AG's office, so we were working to get those distributions out by next week. That's when we anticipate having checks in hand, so money can start flowing to these cities and counties from this distribution. One other note about this distribution, this should be the largest individual distribution to cities and counties that we will have throughout the entire lifetime of the settlement process. The reason for that is the Johnson & Johnson settlement paid out the vast majority of that settlement. It's about $34 million to the state total for the settlement. They've paid about $25 million in their initial payment because we had 100% participation from our litigating cities and counties. The end result of that, though, is that future payments to cities and counties will likely look smaller than the ones you're looking at right here. Do I have any questions about the funding that we've received so far? So the difference is that they are from 3 different settlements. One is from the Janssen settlement, one is from the Mallinckrodt settlement, and one is from the distributor settlement, and the exact calculation on the back end is a little bit different based on each settlement. And the reason for that is that each settlement will have a different percentage of what we call base payment and a different percentage of bonus payment. And the difference between base and bonus will impact the exact calculation for litigating cities and counties. They get more out of the bonus because they were litigating to encourage them to sign on. That was the original incentive plan. And when we get into the CVS, Teva, Allergan, all of those settlements, there'll be different exact percentages for each of those settlements as well, because the base bonus in each of those settlements is a little different from Janssen or the distributors.
Blue if you're on, so. And turn it off when you're done.
Any other questions on the new settlements or the distributions?
Yes. Did you say the cities and counties have already received these funds?
These funds are going out next week. We had anticipated getting those distributed by the end of December, but there was a hang up on our end that delayed it until next week.
We've already received one allocation, is that right, or just one
Just
allocation?
the one, yes. Yeah, the cities and counties have received one allocation out of the McKinsey and Associates settlement dollars. That was considerably smaller than any of the settlements that you're looking at right now, except for the Mallinckrodt. It was about $4 million to the state, so distributed about $1 million to the cities and counties. If you look at kind of the percentage number that's on the chart, you can do a little bit of rough math in your head that many of these cities and counties received less than $1,000 out of that McKinsey payment.
Out of curiosity, was there any city that opted out that is bringing their own suit or?
every city and county that had brought lawsuits prior to the enactment of the Kansas Fight Addiction Act signed up for this settlement process. Part of the Kansas Fight Addiction Act statute is a legislative bar on any city and county bringing new lawsuits without permission of the Attorney General's office. And the reason we needed that bar was each of these settlements includes language that would reduce our payment pretty significantly, usually by 2/3 or more, if any city and county brought a lawsuit subsequent to us entering into the settlement. So there are cities and counties that opted to not participate in this settlement program, but there are no cities and counties that can now, on their own, bring a new opioid lawsuit.
So one more question, I'm sorry. So are cities and counties restricted, they have full privilege to use the funds as they see fit, or?
They're restricted into using them for the same abatement purposes that the board is restricted to, but beyond that, they are able to have discretion within that space on how to use those funds. One other thing that this has been raised by cities and counties in the past, they do not have to expend the funds in the same year that they receive them, but they do have to report to the AG's office, and we'll transition into the reporting topic. They do have to report to the AG's office how much money they receive and how they expend those funds in any given year, so that we can then report, add it to the report that this board has to do to the legislature and to the governor's office and to the AG's office, as well as add it to any report we would have to do to the settlement administrators or bankruptcy trustees.
I believe that every city had to enter into an MOU, which stated all of our requirements, correct?
Yes.
Yes, so I was just looking for ours, and I know.
They adopted a resolution joining the MOU. They didn't have to individually sign the MOU. Under the terms of the MOU, it's the League, the League of Kansas Municipalities, the Kansas Association of Counties, and the AG's office are the signatory parties to the MOU, but each of the participating cities and counties adopted a resolution to participate under the terms of that MOU.
Those that are online, you've probably done these meetings, but there's a button, I guess, is a way to explain it, that you can push if you have a question that we can see. Also, Lori's joined us online as well. So, Chris, I think we'll move on to point 4, item 4.
Very good. So on to point 4, the reporting requirement. I want to make certain the board is aware that the annual report is going to be due after the next meeting. We anticipate the next meeting happening towards, we'll probably get into this later, but towards the end of February, and the first report from this board to the governor, the attorney general, and the legislature is going to be due, I believe that is March 1st. And so we will have to have the board approve the report next meeting. The content of that report statutorily is fairly light. It is simply how much money did the board receive, or how much money did the KFAF receive, how much money was expended, and I believe any other information that is the board deems appropriate. So I wanted to open the conversation at this point to what other information does the board want in that report. We anticipate at this point that the report will largely just be about receipts for the 2022 report, as there were no expenditures out of Sunflower, and I don't believe there were any expenditures out of the AG's allocation that the board approved last month, although I'll double check with our office on any expenditures that were there, and we'll report those. So it really is kind of be up to the board on what additional information the board would like to put into that report. But any narrative statements, any expressions on the goals of the board for 2023 or the goals of the expenditures that the board is planning to undertake in the future, strategic plans, things like that can go into this report. The other thing that I believe I'd recommend to the board is that we would include the data that the AG's office is collecting about the municipalities' expenditures into the report that the KFAB makes to the legislature, just so that from a transparency perspective, all of that data is collected into one place and is easily accessed by both oversight from the legislature and by the public. But at this point, the board should, if there are any additional things the board wants to add into the report, now would be the time to have that conversation, because by the time of the next meeting, we wouldn't be able to incorporate anything meaningful.
Thank you, Chris, and we'll, any direction from the board? I have a little, having been on the receiving end, looking around the room, most people on the board, you'll probably get reports, and so there's a lot of reports that come into the legislature and governor's office. The more succinct, for sure we want revenues and expenditures in there, and I think it's very wise to include the municipalities, the same for them, because if the legislature has questions or get questions from their constituents, it oftentimes is in regards to the money and how it got spent. As we develop, maybe we could put a little bit about the RFP and that process, but succinct is maybe the operating word, more likely to get looked at. And we certainly want the legislature and the governor's office to be involved and give us direction. We're all appointed by those folks, so we'll give them at least the basics, and of course we have all kinds of information available to them. So any suggestions from the board to Chris?
One thing, Mr. Chair, that I forgot to mention, there is a statutory requirement for an explanation of how the board's actions during the year have complied with the requirements of this act. I don't anticipate that would be a particularly long statement at this point, especially for the 2022 report year, but there does need to be that sort of statement. If you wish to draft a statement or something like that, just so that we could add to that report, I think that might make sense, just as a confirmation or compliance with that particular statutory requirement.
Chair, I just might throw this out. Just, would it be helpful, would the board think it would be helpful in this report from cities and municipalities to just put how they're spending their money into a very generic pie chart kind of format? And my thought is just give categories like, is the money being spent on education, prevention, or treatment? And because I think moving forward, that gives us an idea of how the money is being utilized. I think as we learn over the coming years, we'll probably develop opinions about the best way to spend the money for impact. And I'm looking to Jason and Sandra, who do this kind of work day in, day out, for feedback. But that doesn't seem to me like it'd be a tremendous burden, but it might be helpful to us in the future.
Chris, it'd be up to you guys, and we could use the categories as we develop, our RFP. We're using priorities in there, and maybe we wouldn't have 8 categories, but we could have 2 or 3, and then when they, if I was submitting on behalf of my community, I would just put $1,000 spent on treatment, or in the broad categories, and then you guys could pie chart it or graph it or something with that.
Yes, I think that makes sense, and there are categories already established within the abatement strategies documents that are in the settlements that I think we can use both at a high level and a low level. I anticipate the report that the cities and counties would produce is not going to be particularly detailed on deep explanations, but it will, especially for this first report, be a statement of how much money did you receive, what did you spend it on, and a statement of what strategy that is going towards. To make it easy for the report, though, I think that some kind of consolidated chart explaining those different expenditures does make sense. And so using categories would be a useful way to do that.
Would there be,
How would you, I'm sorry, online, how do you want me to indicate that I have a question? There isn't a raise hand function on here, is there?
Yeah, I think there is, but looking at our IT person.
So there should be a raise hand function on the lower part of your screen. Do you see anything like that?
This is Monica. I don't.
Monica, I'll just listen for now. Maybe it can hunt around, but there's not that many. So if you just
It was
speak
actually
up.
Lori
Yes.
that had the question.
Oh, okay. Go ahead, Lori.
I was just wondering what the categories would be. I like this idea. And I know initially some categories were thrown out there, and then there was a mention that there are other categories already established that it might be good to align with. So I think if we're going to do this, we need to be clear about what the categories are and what the definitions are for those categories, and that everybody is using, because it can be very, it can be difficult. There's some gray areas. What is considered treatment? What is considered a recovery support service? And so just having a good definition that all the counties and municipalities are using would be important.
As when Krista gives her report, I think she can outline some of the thoughts towards that, and then we might even, that might be something that we can discuss here today, and also entertain other thoughts before we come together in February.
And Lori, I can tell you that each of the cities and counties has received a list of the abatement strategies that were included in the various settlements. A list of opioid remediation uses is generally how it's titled, but we've generally referred to it as abatement strategies. That document, it has definitions within it of what these different categories are titled. And it breaks it in from kind of high-level categories like treatment into subcategories like treatment of opioid use disorder, with a description of what that means and then examples of those types of strategies within the document. This document's about 15 pages and includes a variety of different high-level and kind of lower-level strategies. I think that it makes sense to have a uniform list of definitions and categories. I think that does make sense. I think that building off of the strategies document might be the best approach for that, simply because that's what both all of the cities and counties have already in hand. And that's generally what the settlement administrators and bankruptcy trustees are also going to be referring to when evaluating any reports that we make up to them.
And looking at the core strategies, it's pretty detailed, and if we adopted it as the guide, and we could have, I don't know if we need this many categories, but they could all flow from 2 or 4, whatever we have. Seems like a good way to proceed, because it's already out there and the communities already have it. So.
Chair, this is Mike again. The draft document for RFP outline lists 3 categories: treatment and recovery, harm reduction, linkages to care. Within each of those categories are very defined services. And my thought would be just to ask for the 3 categories, not to ask the cities to go into real detailed definition of each of those. But I think I think in this draft document kind of spells it out fairly well.
Yeah, and that was my intent, is that we would have perhaps those three categories, but then if somebody's getting into the weeds, we have the strategies that even defines it more. You know, I'm not an accountant, but you have the chart of accounts, and sometimes you have to get into the weeds to find out which account to put it in. So if there ever came up, we'd have this guiding document.
This is Sarah. I agree with what Mike is saying. I think that it needs to be very broad if it can be on. We have to remember that some of these cities are receiving $300 and they have a very part-time accountant. And that accountant doesn't speak social service terms. And so if we want real data, we have to be able to give them defined what it is and not go into deep details, because those cities that are receiving $400 or $500, we have to really think about what the cost benefit is and what they're really going to give. But I do agree that some reporting is important, but having really some good, solid definitions, explanations under those categories are going to be critical, because the league is going to get calls. I can guarantee it. And John is going to love that.
Yes, most of the cities and counties will likely also reach out to the AG's office, or me specifically. I think then what we'll do is, prior to any request for data, which this would be over the next 2 weeks or so when the request would go out, I'll work with Sunflower to see if we can come up with a kind of uniform set of definitions that we will then include in a explanatory letter to the cities and counties that will also be shared with the league and the association, so that we're all on the same page of what we're asking the cities and counties. To be clear, that data that we're requesting is pursuant to the MOU, not pursuant to any aspect of the statute that would govern the KFAB. Not to say that your input isn't valuable. We very much value that input. It's just that the specific terms of what is required is under that MOU. But I think that those definitions will work with Sunflower to make certain they're clear, easily understood, and, as to Sarah's point, not a ludicrous amount of detail required, because we want these reports to actually be done in a timely fashion and not just ignored to the extent that we can.
That'd be great. I know Lori has a question. Lori?
I was curious if we are going to have an opportunity to discuss these three categories. I'm not sure I understand why treatment and recovery are together and not separate.
Yeah, Krista will have that in her report, which is coming up.
Okay, great. Because if we're going to use them for this, to ask counties to report, I would be advocating to separate treatment and recovery.
Okay. I think we're ready to move on to, Chris,
Yes.
do you need any more direction from us? Or?
No, I think that's sufficient direction, and we'll have a draft report ready for you by the next meeting for approval, and if we have to get any kind of edits or anything like that, we'll figure that process out at the next meeting.
Okay, thank you. Krista?
All right, I made slides. Can everyone hear me okay? It's weird. Yes, you should. I made slides. I have them printed for everyone in here, and then also I believe we have them to share online as well. It's not any new information. It's just a summary of all of the documents we sent out, since it's an abundance of information you all got electronically. We just thought it might be easier to look at a PowerPoint. So those are going out around the room right now. And I will say, while we're passing those out, that the strategies in here that we're proposing for the first round of funding come from the Kansas Prescription Drug and Opioid Advisory Committee's state plan. So that's why those strategies are not specifically the same categories or listed the same way that they are in that abatement strategies list, because it came from our Kansas state plan. They still fall under all of those same categories. They just aren't defined the same way. And so that's why treatment and recovery is lumped together, because that's how they did it in the state plan. I agree with you. If for reporting purposes, it would be good to, I would assume, to split those out, and we can talk about that when we come to like grantee reporting and whatnot. It looks like everything's been passed out. Also, before I start, I received an alert from the CDC Foundation, who also works with Midwest HIDA with the OD map data. So that's the naloxone administration data or overdose data from law enforcement or EMS, any other first responders. And so they saw a pretty extreme spike just this past month in January. So the first 2 weeks of January was really significant. They typically don't send that data out to any stakeholders that aren't able to access that data, but since it was so significant, they did want to alert stakeholders that typically don't know this information, since it can be pretty sensitive. And so he approved me to share that between January 13th and 16th, we had 103 suspected overdoses with 3 fatalities in the state, and that was pretty significant. There were 7 different counties that were that met that threshold for the overdose spike during that time frame. And he expects that January of 2023 will have more than 1,000 suspected overdoses for Kansas, which is really concerning. The prior 6 months, the highest number we had was in July of 22. That was 971, and then everything else is below that since July. It was 945 in August, and then it goes down into the 800s and 700s after that. But that's pretty significant. They just wanted you all to know that, so that we're just aware that overdoses are spiking and they're seeing that, and it is concerning. And so I just wanted to share that information with you all. He also, right before this meeting started, I didn't get to read the email, but there were more that came through since the last time he sent me information, so there's even more than that now. And then also the SAMS has been sending out information about the data waivers. So for medications-assisted treatment, the physicians have to go and get a waiver to be able to prescribe things like buprenorphine and whatnot for medications-assisted treatment, and they are eliminating that requirement federally, so hopefully that will be some interesting progress that happens. Yeah, so that was exciting news, at least a little bit better news than the first set. So that was unrelated to the presentation, but wanted to make sure that you all are aware of it as well. So the second slide is the just kind of the 3-pronged approach we talked about at the last meeting. So we decided that we'd have a proposal today about the 3-pronged approach. So we have something where we start with an interim funding strategy while we build a comprehensive needs assessment, and using that Kansas Prescription Drug and Opioid Advisory Committee's state plan and all of the other data and resources we already have in the state to get us started. That way those communities aren't waiting up to a year for something like a needs assessment to really guide our long-term strategy. And that needs assessment is that second prong. And then the third prong is having a responsive grant-making options so that we're not just stuck to the rigid RFP processes, so that there is some flexibility throughout the year as well for things that might arise. And Brandon will share more about that later. And we'll talk about each one of these, starting with the interim funding strategy. So what we're proposing on the next slide is the draft interim. It's just a title page if you go to the next one where it says RFP 1 and 2. So slide 4. We're proposing that we split these RFPs, the request for proposals, into 2. So looking at the statewide strategic plan from that Kansas Prescription Drug and Opioid Advisory Committee, it's not even finalized yet, but you all have that draft. It's still waiting on KDHE and KDAD's approval, I believe. But I wanted to get you all that information so we could have this conversation. The strategies won't change, but some of the content and the design of the plan might change. So they have 6 different categories that were of priority in the state plan. So they had treatment, recovery, harm reduction, linkages to care, prevention, providers and health systems, and public safety and first responders, and also criminal justice and law enforcement all fit under that last category there. And so we're suggesting that instead of doing 6 RFPs like we originally thought, we would do 2 and split them into 2 different RFPs with 3 categories, and lumping them together by highest priority, which are the treatment strategies anyways, but then all of those categories under there too. So treatment, recovery, harm reduction, and linkages to care, kind of lumping them together as like service provision of treatment. Of course, there's a little bit of variance there, but then we thought the last 3 were more prevention focused. So that includes the prevention area, providers and health systems, and public safety and first responders. We would have that RFP go out first for treatment, And then we would stagger the rollout of the second one until we close that first RFP to give us time to ensure that we roll it out and we have time to test our processes and systems. And that way we're not getting overwhelmed with the review process for everybody involved. So we thought we would try that out and see what you all think there. And we would want to make sure that when we release RFP 1 for treatment, that we would also announce when the prevention one will be released and a little bit more information on it, so that those that are interested in those kind of strategies know that something's coming. They don't have to make it fit within this treatment RFP. We also looked at the state plan, their cross-cutting strategies is the way they call it, but they're just kind of topics of interest that came up across all of the subcommittees in these areas that were of concern, things like stigma, workforce, and several others. We thought that those could be things that we list as priorities. So if they're addressing workforce or stigma, or they're trying to address those different factors, we could potentially have them as priority status when we're reviewing. And then also if they are in one of, or servicing one of the counties that is ranked as highest vulnerability according to KDHE's vulnerability assessment. So there are, I believe, 21 counties that are at the highest risk. There's in that 5th quintile from that report for overdose deaths. And so if they were servicing those counties, maybe we take that into consideration when we review as well and give them a little priority for that. Not that we would ignore or not accept proposals from other counties, but just something to consider when we are trying to rank score applications. And then of course we would also be giving priority for science and data driven and innovative strategies, as we're all interested in the innovative strategy piece, and then the science and data driven coming from the legislation specifically. Yeah, any questions on that so far?
If there's any questions before Krista continues?
This is Monica.
Go ahead, Monica.
Krista, could you please restate what you said at the very beginning of your conversation when you made the 2 announcements, the number 2 announcements regarding certification, I believe for physicians and MAT, and does this impact what we're looking at now?
Not specifically. I think it will just make things easier and increase access to treatment in the long run nationally. Just because that is a barrier. So the providers that wanted to provide medication-assisted treatment had to go through a training course, and they had to get a waiver through their DEA license. And so they're trying to take that barrier away so that they can prescribe. And then I don't think it will come until later this year or maybe even next year, but the DEA is going to work on some required education when they update their DEA registration, or if they are new to getting a DEA registration where they'd have to have some kind of education. I think they suggested maybe up to 8 hours like the original training was for the waiver, but it wouldn't be, they wouldn't have to have that waiver to provide treatment. So that's just a big change federally.
Okay, thanks for restating. Thank you, Mr. Chair.
All right.
So then the next slide, on slide 5, is the breakdown of all of those strategies for consideration under the treatment larger category. And so that includes the treatment and recovery strategies, and those are listed in ranking order from the state plan. And then the ones that are bolded are also when the subject matter experts public comment, or the public comment survey, or the interviews that they did with subject matter experts said that those were high priority areas. And so those are the bolded ones. So those are the highest of the high priorities. And then harm reduction and linkages to care the same way. I also will note under harm reduction, I removed any strategies from consideration that are considered illegal in Kansas. So like safe injection sites, fentanyl test strips, and like needle exchange kind of things, syringe exchange programs, since those are currently considered drug paraphernalia. I'd assumed we leave it off here, but the full list is in that framework document as well, if you guys want to see the full list that includes those pieces. And then I also left off on treatment, the statewide treatment navigation system recommendation, because that's probably something that we would want to maybe look at the needs assessment and see what's really needed across the state and wait for something like that, or just have it have its own RFP, because that seems very different and distinct from all the other strategies, as it would be like a one, most likely one vendor that would do something like that, if that's what the board would want to explore in the future, but I didn't think that it would be ready, I guess, for this first round. And so I just wanted to open it up too, as if the board is wanting to include all of these strategies, or if there are any further discussion we need about any of these. I had a few questions to start the brainstorming process off about specific strategies with, for example, social detox. Are there any implications to us funding that system where they just lost funding from the state opioid response grant from KDADS, and SAMHSA's seeming to move, they are not approving social detox under that SOR grant as an effective strategy, and if anything would, if that would have any implications if we were to fund it, just things to think about. And maybe a question for Chris too, with the TIVA settlement, there might be naloxone a part of that, so if we need to consider that when we're funding naloxone statewide, and then, yeah, open it up for any other discussion about, do we include them all, or do we take some off? Do we add? What do you all think?
I have a question. Number 8 notes jail-based SUD treatment and reentry programs is focused on justice. Are we considering a similar option for folks coming out of hospitals, treatment programs, those kinds of things, continuity of care types of things, to support folks that are coming out of those places? I don't want to take away from the justice piece, but it's the same kind of issue for somebody that's coming out of a psychiatric institution, coming out of a state hospital, coming out of a crisis center, coming out of a residential treatment program, coming out of an ED, any of those kinds of things, and there's not really a framework out there that, and it doesn't look like we would be creating a framework where a hospital could apply to do some of this work.
I believe that will come in the next phase, that continuity of care. If you've been around, that seems to be the holy grail, and what's missing as far as what I'm concerned with. So I would think that we'll have ongoing discussion as we work through these initial kind of priority one grants and immediate needs, but in my view anyway, it's certainly one of the biggest missing pieces we have in SUD and mental health in particular. So, Chris, I don't know if you want to add to.
Yeah, I think that makes sense. It kind of is highlighted in the providers and health systems section, like you're saying, but it's not at the same level, I would say, as the justice settings. So I would be open to, if we wanted to have like a continuity of care model for high-risk populations, including justice populations, and, hospitalized. I don't know how we would word it, but something maybe adding to that one under the treatment and recovery. We could do that if you all would want to do something like that.
Yeah. With what he said, because that over 1,000 overdoses that are going to happen in January are going to land in a hospital, and if we don't have a simple and fairly accessible way to get them to treatment, we just discharge them right back to where they came from.
This is Mike. I'd echo Robin's comment there to Jason's idea. Because a lot of times I'm thinking for smaller communities, a singular treatment team, small treatment team could provide services to both, whether it's release from jail, release from hospital. So this would help smaller jurisdictions to be able to serve just a broader. It's very much similar services. Doesn't matter where you're coming out of.
I'm going to just pause for just a minute here. If you don't mind just raising your hand as well, because that way the people that are online are raising their hands. So I'm going to go to Lori right now. I'll try to keep track of people as you raise your hand. I hate to be like that, but having done this in legislative committees, it just seems to work better that way. So Lori, if you want to go ahead.
Yeah, thank you very much. And if everyone in the room could just speak in your mic, that would make sure to help. I didn't get to hear all the comments. I just wanted to come back to the idea of putting treatment and recovery together. I understand that's how the other committee did it, but the SAMHSA funded Peer Recovery Center of Excellence just released 2 reports called Optimizing Recovery Funding, and the recommendation was really pretty strong that we have for too long put treatment and recovery together, and then we can't know exactly how much funding is going into recovery services in the long term. And it's becoming a problem in looking at, are we really funding recovery services? And so I think rather than repeat, what has become a real challenge, if we could find a way to separate those, I think that would be important. And I can provide links to that report that just was released. Was a pretty extensive survey, interviews. They surveyed all of the all 50 state SSAs. And so I think it would be a good opportunity for us to be the first to learn from that report. And in those same lines, I noticed that in that category, treatment and recovery, where would you see funding for like recovery community organizations and those groups that build recovery capital within a community fitting?
I'm going to have Krista respond to that, and then Sarah has a question.
Yeah, I think that's a great point. It might have just been something that wasn't included in the state plan. This list is just what was included in our state plan, so it wasn't anything above and beyond that. So we could add that in there as well. And I don't see why we couldn't split treatment and recovery out too and have 4 categories under this first RFP if that's what the board would like to do. Most likely, that will be the easiest way, like you were saying, for us to report financially as well by those larger categories for all grants. And so it might make sense to do that further in advance instead of trying to adjust later down the road.
I like that thought too. I don't think there's any objection in doing that, Krista.
Hi, this is Sandra. Just clarification, Krista, before I give my opinion. So this first set of RFPs is really about how can we begin to address immediate need, right? So I want to add my support to what's been discussed about coordinating care. And it's not so much about setting up a system of coordinated care, but what we know, whether we're treatment or hospital or jail, is when we put someone in social detox or someone's in jail or someone's in treatment, a lot of times that's considered the thing. And what we know is it's much harder when you leave. That's the most vulnerable time. And access to that next level of care, access to peer support, access to outpatient treatment, sometimes you have to wait. And so that gap reduction of having someone connected to you to stay in contact with you and really help advocate with the system. It's one thing if Mike needs treatment and he's calling me, but if Keith is his advocate and knows the lingo and the language and the back doors and the funding, Mike's going to get into treatment more quickly. So I just really support a notion of how do we help people get to where they need to be and support them while they're doing that, while they're waiting to get into treatment.
And I agree 100%, and maybe we can do something because there is a immediate need. Everybody's voiced that, but there's such a, to develop a strategy. I think I've made known my thoughts, when we first got together, is that it's a critical piece. Being in recovery myself and having worked in the field, that gap, we'd no more think if somebody had a heart attack to put a couple stents in, and then we'll get back to you on the follow-up here in a couple weeks or a couple months. And with an addict or alcoholic, it's even more crucial to not have that interruption. So certainly support what Sandra said, and Krista will take that into account as we develop the RFP.
Yeah, I think that makes sense. So do we have interest in adding something about recovery-oriented systems of care, or if we want to say RCOs or the community organizations, I'm not sure, but do we want to add that and some kind of coordination of care strategy? If so, how do we want to word that?
Do we want to treat this as a strategy or a priority? Somebody that presents in their RFP. Thoughts from the committee? Lori, go ahead.
I think that's a great idea. I would say the language that's being used now are like organizations in the recovery ecosystem. There are other kinds of organizations other than RCOs, like recovery cafes, recovery centers. And so a more umbrella term is the recovery ecosystem. And well, I'll just leave that for now.
So that's helpful.
Any other questions or guidance? Or you have enough guidance there to work on?
I might ask Sandra, what kind of language do you think would get that point across of what you were saying as a shorter strategy?
I knew you were going to ask me that question. I don't have a quick answer for you. I think I might punt this down the rail here, because there are organizations, whether it's mental health, substance use, primary care, population health, who do this type of work. And so maybe we could take some time to think about it. I mean, I'm happy to talk with you or have Jason step in here.
Well, and, you know, because we don't need to do it right on the spot, maybe if you two want to discuss and work with Krista as we develop this, you know, over the next couple of weeks, that would be very beneficial. Monica?
Thank you. I would agree that letting the experts here in the room, Sandra and Lori and the others, work with Kristen to clarify both of those intents. And can I just restate again, it's really hard to hear if you're not talking directly into the mic. So Sandra, I got about half of what you said. I can't tell if your mic is cutting out or if I don't know what it is. And then also Pat, having a really hard time hearing you too. I just don't want to miss anything. Thank you.
All right. Yeah, it's just to be cognizant to about talking into the mic. I'm used to not doing that, so most of us are, so we'll make a concerted effort. Lori, you have another comment?
I just wanted to say I'd be happy to work with Krista.
Thank you. All right.
Okay. In any of these categories, any strategies we need to discuss specifically or things that we've left off? Or if we want to reprioritize, if we think there are too many in any of these lists, any thoughts?
You know, this will be a work in progress as we go, and you know, I think we got about 18 years, so 17 years left to develop these as we go. So.
Good deal. I just want to make sure we had those discussions. And so, are we all okay with these being the strategies that are listed with the ads, separating treatment and recovery, of course, but then also adding in something about organizations in the recovery ecosystem, and then coordination of care that Lori will help with the first one, and Sandra and Jason will help me with the second one. Are we good with that as our list to go forward with the RFP?
I think everybody's nodding their head to accept that direction. And as I mentioned, you know, we might come up with something else here in 2 months or 6 months or 6 years. So I think this is excellent, and it's all data driven and, you know, science behind what we're doing. Really applaud you, Krista, for taking the time. There's lots of data out there to disseminate it. And boil it down to what we have here, so thank you very much.
Yeah, thank you. And I can't take the credit, it's all this from the state plan, so that's all the Kansas Prescription Drug and Opioid Advisory Committee. So I gotta give them credit where credit's due. And I don't know, Chris, if there's anything, TIVA might take a while, so maybe that's not even a topic of discussion we're on naloxone, but is there any issue there?
Yeah, I'll just give a quick rundown on what that point is. Part of the Teva settlement is the option for selecting naloxone for about 10 years. It is 9,100 and some boxes, which includes 2 doses per box. So it's about 18,000 doses per year. The alternative selection, and this is a selection that will be made by the AG. It is not an election that has been made yet. We wouldn't have to make that election until sometime later in probably Q2 of this year. But it is an option to get what Teva is announcing as about $11 million worth of naloxone. They are doing that at WAC price, so take that for what it is. But the alternative would be to receive an additional $2 million to the state if we did not elect naloxone.
And I will say too, from my experience at DECA with the naloxone program, before I left, they were averaging about 2,000 kits, and each kit had 2 doses, so of 2,000 kits a month, and I think it's probably higher than that, would be my guess now. So that would probably be about a little less than half of a year worth of naloxone for that one program that serves the whole state, in reference for the need in the state.
And just to add a little bit more context to that, the AG's office is receiving questions and comments associated with that program. I think it has been recently expanded, but I'm not entirely certain about that. So that the naloxone program is quite, I will say, popular in the state, and that a number of cities, counties, and local agencies are starting to ask questions about that particular program.
Lori, you have a question?
Sorry, I feel like I keep talking. I just wanted to throw out there something to consider as we're looking at the amount of naloxone, that past data may not be our best resource for what we should do going forward, because what we're hearing a lot out on the street is that because of fentanyl, we're requiring significantly more doses of naloxone in order to revive someone. So, 4 or 5 dosages in order to revive someone. And that's kind of a new thing happening with fentanyl. Before fentanyl, maybe it would take 2 doses or 1 dose. And so we may need more doses in the near future than we have in the past. So I just wanted to throw that out there for consideration.
Yeah, that's a great point. And actually, I'll even note that the 2,000 kits a month wasn't even meeting the true need for the whole state. There was a lot more requests, like even like Wichita PD, there was no way that a program like that could provide 800 kits to get all of their law enforcement officers a kit. And so there was still a gap at that point. And there are dollars going towards naloxone from both KDADS and KDHE, but I would assume it's still not going to fully meet the need. But I didn't know if the Teva settlement might throw things off or not.
And if the board has a specific recommendation that you would like me to pass on to AG Kobach, I can do that, because it'll be ultimately his decision on whether or not to elect into that program. One key note about that is that we can elect into and out of that program every 2 years for the lifetime of the 10-year settlement. So if we decide we want to elect in now, we can, and then in 2 years, if we decide we no longer need that particular point and would rather have the cash equivalent, we can elect into the cash equivalent in 2 years. We can make that decision once every 2 years.
We'll try to provide some guidance here. You said that's probably a Q2 decision, so maybe in February we'll have better data or more up-to-date data and give you our opinion.
Yes, that would be helpful.
So for now, are we comfortable leaving it in here as a strategy that they can apply for?
I believe so.
Okay, great. Any other treatment items before we move on to the RFP2 categories?
Good to go.
All right.
Thank you.
So then on slide 6 is where we outline the strategies for consideration under the prevention RFP that we're just calling all prevention. So it has the prevention category, the providers and health systems, and then public safety, first responders, criminal justice, law enforcement, all of those kind of categories lumped together there. And like we were saying, with a staggered approach, we would release RFP1 with treatment and then learn some lessons, see how it goes, and see if we need to adapt anything for RFP2. And then also, I think I forgot to mention earlier that we're recommending that grantees be able to apply across priority areas and for multiple strategies. If they have an innovative, really comprehensive approach that could address all of the areas, we wouldn't want to create a barrier to where they couldn't apply for those. So that's why we're thinking they could do multiple strategies and multiple priority areas under treatment, and same for prevention, and potentially apply for both. But then they would just have 2 separate RFPs, one for the treatment stuff and then one for the prevention, so that they didn't have to do 6 or more different RFP or applications for funding. So under prevention, you'll see those strategies. I will note that I had to shorten a lot of them for this slide because a lot of them, especially the providers and health system ones, are really long, but that full list is in your framework document as well. They're all listed there. It's just they're shortened versions of the full strategy. So any of these that need discussion or anything missing, we can obviously continue to hone this one as we move forward, since this one would probably be closer to like an April or May rollout, depending on how quickly we roll out the first RFP. Lori, you can go ahead.
Sorry, I was wondering, one thing under providers and health systems, number 8, expand implementation of best practices for treating women of childbearing age. We might want to just expand that to say people who can become pregnant. And then also, I wonder if we need to, in any of these categories, specifically call out adolescent treatment. We know that there is a huge need for more resources for adolescents and young adults to receive treatment. And it could be that it's just included under some of these other categories, but if we specifically call it out, it may potentially encourage applications that are specific to that population.
Does anyone have any ideas of where it might fit? Oh, Robin, behind us with a question.
I don't have a question. I just want to echo what she said, because trying to find resources for this for kids is next to impossible. So I agree. Let's have that be a separate item.
Yeah, I think that makes sense. Sandra?
Would that not go in RFP1?
That's what I was going to ask. Do you think it falls under the
Services.
treatment? And Monica, you want to go ahead?
Thanks, this is Monica. I agree. Any place we can specifically call out kids anywhere in the RFP 1 or 2, I think that's a great idea. I'm glad you brought it up.
Any other comments or questions? And maybe something like that might just be expand access to adolescent treatment services, or would it be more broad than that?
Well, we could do treatment services as well as adolescent recovery services in the recovery category.
Okay.
I hate, this is Sarah, I'd rather us be more broad on that. I don't want to just do treatment, and I don't want to just do recovery. I think an ounce of prevention too. I mean, I think we have to put it, and I know we're talking about 1 versus 2, but I mean, I'm echoing kind of what Monica was just saying about how if we can put an emphasis on youth in several places, I think it's beneficial.
I think that makes sense. Do you have a suggestion for what we would put under maybe prevention or another category for that too, and under the prevention RFP?
I'm going to echo what Sandra said too. I just said it. I haven't really thought that way through, but I'll get there.
Robin, did you have?
We've kind of called out kids in prevention when we said expand school-based programming, so that's all going to be targeted at kids. But I'd like to see us think beyond school-based to social media. I mean, that's what kids are all plugged into, or nothing else is coming to mind right yet, just right at this second. But I think that we've got to figure out more ways to get to kids, because that's one of our fastest, at least what we see, one of our fastest growing problems.
Could it be, instead of saying school, could it be something just about engagement, engaging? Yeah, that's really broad, because not every, it depends on what you call school too, school-based. Expand implement.
Specific to like school-based curriculums and actually making sure that they're getting that kind of education in the schools. And so maybe it is a separate recommendation.
Robin?
I think I agree with what Krista just said, that we should, I think I hear where you're going, Sarah, but I also think calling it out specifically so schools can do this and see that there's a specific place for them to require for, to apply for grants is important. And maybe have a second category that we figure out other ways to get to kids.
I'm shaking my head, yes.
Monica?
Thank you. I want to, so if I were a school district administrator looking at these broad categories, historically, I would have thought about the prevention world as defined by KDAD's funding. So, thinking about like specific programs, curriculum, those kind of things that have previously been approved to be done in schools. And we know that is being negatively impacted by last year's piece of legislation regarding parental consent for those programs. So I want to make sure that we don't send a message that it's just, and I say just lovingly, the particular programs that have been approved that local groups are using. I'd like to be really clear that we are encouraging school districts to engage with SUD providers, behavioral health providers, to do actual services if it is appropriate with partners. I'd like to just open the door as wide as possible on this for school districts to consider themselves part of the solution here, or for community groups to partner with school districts to do that. I'd also really like to make sure that for those providers, such as Robin mentioned, that are trying to provide multiple strategies but just can't get it done, that we're encouraging innovation there also. So not just school districts, but anybody who gives a dang about a kid and is willing to try to take this on. So that is not helpful to Krista. She needs words right now, but I'm going to start writing and penciling because I don't have them right now, but I just hope we do a pretty broad stroke here.
Yeah, please send those in to Krista or get them to her. And obviously, we don't want to go afoul of the legislature, but we want to do all that we can to help those out there suffering. Keith?
One of the constituent groups in our community is community corrections, and our community corrections director asks me monthly, when is this money coming out? And she's constantly saying, we don't have any resources for the kids that we have in service with us. And so I think just that group of community corrections providers across the state need to be encouraged to apply, because I know that that's a constant concern. Changes in the legislature have given them less authority to really impact kids. If they had resources, that might help. So I think that's just another constituent group besides schools that we should perhaps target.
I think that's an excellent point. Probably more likely the kids we want to impact are more in the juvenile justice system than in school. We want to get them back to school. So, thanks, Keith. And Lori, you have a comment?
Yeah, I actually have a question for everyone. Do you think we should specifically weave into RFP 1 and 2 anything about culturally and linguistically appropriate services? I know that the federal Department of HHS has been advocating to put that in all of the FOAs that come out from HHS. And I had a question about whether we thought that we needed to call that out here. We know, and it made me, this conversation actually made me think of it because there is good evidence that culture is prevention. So in thinking about what Monica was saying, which I totally agree with thinking in broad categories, we know that, for example, in Native communities, focusing on culture and teaching young people about their culture is a preventative strategy and helps them build their ability to have positive factors in their life. So that's my line of thought anyway. It's a question for everyone.
Robin?
I really like that line of thought, and it's something I hadn't gone there in my head, because we're not going to create a lot of new agencies because the workforce is so slim that we've got to figure out how do we tap into existing agencies and make this so broad and encourage creativity that some of these existing organizations jump into this and see, oh, there's a spot I could apply for a grant. I don't do that, but if we can develop resiliency in kids, and like you're just talking about with the Native population, pride in their culture, and really become strong-minded kids, maybe we can help prevent them from turning to these other solutions that they see as, I use that word solutions loosely. Drugs aren't a solution, but for some kids it might be. It's a way out of wherever they are. So that's not very well thought out or well said, but I support what you said.
I would take that one step further, Robin. I agree. So we know that there are entities in the state who do this work, mental health, behavioral health, addiction work, healthcare, who will apply, and they should. How do we encourage within the language of these strategies those unusual voices, non-traditional groups who could have as much, if not better, impact, specifically in the areas of equity, diversity, and culture? How do we encourage that so that we really are being innovative? And I know for the folks, because I used to be one of these rule people, you have to follow the rules that are given to you by your funder, your licensing entity. How do we support people who can't do that, but still give them resources to really impact their community? So I don't know if that's in the RFP document, Krista, but how do we let people know that just because you're not a licensed drug and alcohol treatment center, a community mental health center, a hospital, a school, that you can apply for this money and have an impact?
Well, I think it's an excellent point because you don't have to fit in the box to have a problem, and so maybe just be sensitive of that, Krista, and we can develop that as we go along. Again, seems like this would fit more in our long-range category, but we certainly want to be sensitive and include help for as many people as possible in this first round, this first year, so to speak. So I think it's been well noted and good points. And does that seem acceptable to you, Krista?
Yeah, I think so. And I think that's one of my hopes and dreams too for our process is to do more of that and be a little bit more flexible than say a federal grant or a state grant that might be have too many barriers or too much red tape that people aren't able to apply, or they're spending too much time reporting. I'm hoping that we might be able to do things a little differently. I don't know exactly how we word that and get the word out appropriately, Sandra, when we release RFPs, but I agree with you.
You know, just broad language, because you hit on maybe the big word, barriers. We know that is a big deal for mental health in general and substance use treatment, specifically.
If we
Lori,
have language-
comment?
I just wanted to ask a technical thing. If we have language to send to you, I don't know that, do we send it to your email? Do we have your email address? I'm sorry.
Yeah, we'll get you her email, and feel free to send comments to Krista.
Okay, thank you.
All right.
All right, any other discussion opportunities for that on the prevention? And like I said, we have a little bit more time to hone the actual details, since that one wouldn't be released first. But good to have these in mind, and I have notes of things that we want to add and whatnot too, to try to take a stab at that. And if you all have suggestions, yes, please send them our way. But any other prevention-related topics of discussion?
Oh, seeing none.
And I'm assuming that also includes providers and health systems, and then the public safety kind of side too, this whole category.
Yep.
Okay, great. Next slide, on slide 7, is just kind of where we'll talk about just more of like the process of what it's going to look like. So all applications, reporting, and grant review, all of those things will be done in our Sunflower Foundation grants management system. It's called Flux. And so we've already started building that out and getting it ready to go, and we'll revise as needed based on feedback today. We're recommending, if we're ready for that, that we could release an RFP potentially early spring. In the draft RFP, I used a sample of if we released on March 1st. Not that we would have to release on that date, but if we did, what the timelines might look like associated with that date. So whatever we choose, it would be the rest of the dates that are associated would be pushed back. But releasing potentially early spring, leaving it open for 6 to 7 weeks to give them enough time to apply. And then, of course, we'd want to coordinate any of the deadlines we set for grant review and approval, and when we would do award notices and whatnot with these board meetings, so that we have the best timeline of being able to get the review done and approvals and whatnot in the best, most efficient way. And so that will be also something to consider when we develop timeline. When we do release an RFP, we would release a Word doc version most likely, or potentially a PDF version, but it would probably be a Word doc to make it easy on the applicants. But we'd release that first with all of the text like you've seen in the draft, so that they have that in advance, and then the system wouldn't open for a couple weeks after that, after we have that first webinar. So hopefully we'd answer some questions about the system itself, so that would reduce any confusion about trying to get online and fill out an application before the webinars. And so that would give them time using a Word document to start replying to the questions. They'd all be included in that Word doc, so they could start building their application, just copy and paste in the system when the system opens. And Brandon has said that in the past at Sunflower, grantees have appreciated being able to just copy and paste from a Word document. It's a little bit easier than doing it all in the online system and making sure you save as you go and they don't lose information. So that's kind of how that would work with the release. And we would have those 2 informational webinars probably at least a week apart and on different days and different times of the week, so that hopefully the most people can attend as possible, and that we would record those and also post them on our website so that they can access them later, or if they weren't able to attend, they'd be able to see them. When we release the RFPs, we're suggesting at least a start of having a press release of some sort, probably from the AG's office on behalf of the board, and then sharing with our necessary networks. I'm sure we all have a wide variety of networks. The Kansas Prescription Drug and Opioid Advisory Committee alone has a very vast network, so I think that would be another piece of it. And maybe we look at some social media, and we can do promotion around the webinars too. That's to keep reminding people throughout the time, so communications that way. Chris?
Yes, Mr. Chair, if I can jump in here. Just one thing to add on to that. The AG's office has done presentations to various interest groups on the settlement process. Once we get to the point that there is an RFP out there, we can also make ourselves available to, make me available to some extent to do presentations on the settlement process and the fact that this RFP is out there, so that we can communicate to different groups who may not respond to a press release or be available on social media, things like that, that might have other contexts that we can reach.
Yeah, that makes sense. And we might even tag you into the webinars as well. But I was even thinking with networks like the Behavioral Health Association of Kansas, the Governor's Behavioral Health Services Planning Council, all of those different networks, or any agencies like the Kansas Hospital Association, they have newsletters. I think we'd be able to reach a wide variety through that way too, hopefully. So that's just kind of what we're thinking initially for kind of a communications plan. Sunflower Foundation will be fielding all the questions that come from prospective applicants. And then we also will have a frequently asked questions page, which I've taken a stab at what I think there might be some initial questions on the draft RFP. And then we would just update that as we get questions that we think would be relevant to others. So we would keep updating that potentially on our Sunflower website. Like I said, our grant reviews, so that would happen in the same system. I've started a scoring matrix that we can all look at next at the February meeting if you'd like, about how we would score those applications based on the pointage system that's in the RFP associated with each category, and a description of how to rate those in an Excel spreadsheet that is using a template that KDHE uses as well. So we're proposing that Sunflower would conduct that initial review internally and score all the grant applications using that rubric that you approve, and then also completing any of the due diligence that we would need to make sure that their capacity aligns with the application, their financial health, all of those things as well. So that it's a feasible kind of application, and then we would bring those to you all to consider. So we would have our recommended grants for funding, but then you would all have, of course, the final approval or rejection authority, and so you could always access all of the information. We're thinking that might streamline the process for you all if we just did the initial review and recommended to you, and we could give the recommendations of who and why we are suggesting funding and who and why we may not be suggesting funding. To hopefully make it a little easier on you all as well. Let's see. Question?
I have forgotten how much we're allocating in this first 2 rounds of funding.
We haven't gotten there yet, so you're ahead of the game. That's going to come up here in a few slides. But once you guys all approve those grants for funding, we would move into the letter of agreement process, and that's where we would outline the specific scope of work for that grant, payment and reporting schedules, and any of the, of course, the relevant language as required by our settlements and statutes. But that's where it might be more unique as for their payment schedules and all those different things per grant, depending on whatever amounts we end up setting. And then we're just saying that since this is just our short-term kind of interim funding to get the dollars out the door while we're building that needs assessment, we think maybe a 12-month grant term might be sufficient for this one to just get us started. And so that's kind of the rundown of just the process, kind of logistic kind of questions. Any thoughts there? Then the next. Yeah, for sure. Right now, basically, it's just if all the questions, I can do that for sure. I want you guys to review it, and we can send it out in advance. I think depending on whatever revisions you see fit at this meeting, I would adjust it. But it looks like, so the question or the different categories, there are several. So there's like an assessment of need kind of thing, or statement of need category, and it has associated points. And so then the framework just kind of looks like it's 0 to 4 points for this kind of response. And so it just kind of looks like that and goes up to the total max. But yeah, I'd be glad to send that out in advance. Next slide, on slide 8, is just kind of the check-in point. Are we good with the proposed approach? Of course, we'll talk about finances and more, nitty-gritty details at the next slide, but this is just if you're okay with doing a staggered approach, the 2 separate RFPs and the areas that are in there. And will be added, treatment and recovery will be separated. Okay, good deal.
Yes, Pam. Okay. I look for a motion to capture that.
I move to adopt the instructions that are on this slide.
Second.
Second.
Robin made the motion. Sandra seconded it. Any comments? If not, all in favor? Aye. Opposed, same sign. Unanimous. Thank you.
All right. Great, thank you. So next slide is slide 9, and this is where budget kind of conversation starts to come up. And so I also prepared, so the slides in this budget document, I didn't want to have Connie send you another document after all of that we sent out. So we thought these would be okay to just share during the meeting because they're not much new information. It's just things to look at while you're thinking about these conversations. We'll pass those around. And for those online, it's basically just numbers. And so what they're going to be looking at as they're passing it out is just a breakdown of the budgets by the settlements that we've received payments for so far, so those first 4, and what that would look like if we split it evenly across 18 years. And then a breakdown of what the anticipated amounts are, not including Purdue, because that one's so unknown. So that one's everything, including the Teva, CVS, Walgreens, and Walmart, but not Purdue. And then also a final example that does include the Purdue settlement, if you wanted to look at those numbers to start with. And we know this is just to start our first year. We thought it would be good to just try to get an idea of what an annual budget might look like to then help narrow down what we would want to put towards the RFPs, responsive grant making, those kind of things. And of course, based on the needs assessment, we might find that we need to spend more or less a certain year and that we wouldn't be stuck to these like we're not saying today. If we say we want to spend $7.6 million, because that's what the even split is over 18 years, we're not stuck to that for 18 years, but just as a starting point of something to look at. So it looks like everybody has the information. So as I mentioned, so it breaks down all of those different options. And so for you all online, option 1 is just the distributors, Janssen, Mallinckrodt, and McKinsey finalized amounts that we've already started receiving payments for, split across 18 years for our 75%, so not including any of the municipalities' dollars, and also already subtracting the maximum 5% for administrative expenses. That would mostly be the OAG's office and Sunflower Foundation's expenses, and that's just the max that's been set there, so I just went ahead and allocated that as a flat 5%. And then also the $200,000 that goes to K-Trax every year. So I already subtracted those out to come with an actual, this is what we could spend if we had, if we wanted to spend evenly across 18 years. So the first one with just those first 4 is $7,686,782 or 26 cents. I should re-say that because I got all tongue-tied. So $7,686,782 and 26 cents. That's the number for the first one. And then I guess it doesn't necessarily need to be so specific. Option 2, not including Purdue, but all of the numbers that we have anticipated that we've seen announcements for would be about 13.4 million. And then if we included Purdue in our estimate, it would be about 14.9 million a year. And so is that what we want to start with? Do we want to open it to additional potential amounts? These are just like a frame of reference to start thinking about.
I asked Krista to put together this for a starting point. I'll throw out my thoughts on, pretty big on spending what I have in my pocket as opposed to anticipatory amounts. And again, the good thing about this is if in 6 months we can make a budget adjustment or whatever. So I'm just start at that point of I like option one quite a bit, but certainly open to other direction from the board, knowing that in all likelihood, this is going to increase and we're not restricted. We don't have any kind of budget restrictions, which is a great thing. So I'll shut up and
So just so we understand, so Purdue, the 40 million is in appellate court, so it really is at risk of it going down, perhaps, but the others are not being appealed. They are confirmed, just not received. So
Chris, I'll let you.
Yeah, Keith. So the ones that are in the finalized amount column there's actually a consent judgment on file. The Allergan, Teva, CVS, Walgreens, and Walmart settlements are, we have announced those settlements. The states and the companies have agreed to move on through the settlement process, but there are still a handful of steps that could lead to those ceasing to be settlements in the near future. It's unlikely at this point. We all anticipate that it's going to go forward just fine, but there are still some more steps to go, so that's why they're in an anticipated column. We won't have consent judgments on file likely until June or July, I would anticipate.
Kind of like your teenage son, you know.
so then I would agree with you, Pat, that we spend money that we have. I agree with your recommendation.
Just for clarification, Chris, the endo just has a question mark on it, so we just fill that in for me.
Yes, I would love to fill endo in for you. Endo is in bankruptcy. The bankruptcy is the way the settlement would be anticipated to work in the bankruptcy is it'd be a very small amount of money for the state of Kansas. We're less than $10 million, probably quite a bit smaller than that. The question marks are that it is a contentious bankruptcy process. I don't know that it'll be quite as contentious as Purdue, but until we get closer to an effective date, the question marks will likely remain to see if we actually receive any dollars out of that process at all. I anticipate we will have more information later, maybe fall of this year, as to what actually happens there. But because it's bankruptcy and there are lots of people who are interested in that process, it's a lot less certain than a more traditional settlement process. One other clarifying point is that Mallinckrodt is listed at $6 million. That's the low end of the estimate. There's a possibility that will go up just a little bit depending on the timing of when Mallinckrodt decides to make those payments. The way that settlement process, that bankruptcy process is set up, if Mallinckrodt decides to pay early, they will pay the present value of the total amount of money that they would have to pay, which means they would pay fewer dollars, but they would pay it faster. And so, not to get into accounting things that I only vaguely understand, the point there is that $6 million, treat that as an estimate. Do not treat that as the exact dollar amount that we will receive from Mallinckrodt. And if that is frustrating or stressful for anybody, trust me, it's been stressful and frustrating for me for 3.5 years.
So, Bob, should we memorialize the budget amount or suggested memorial? Okay.
Mr. Chair, if you can give me just a moment, I'm going to send this to Lori, Gary, and Monica so that they can actually see that before they vote on that particular issue.
I do have a question for clarification, and it's a Chris thing, so I know you're trying to send that email too. When we talked about the naloxone dosage or doses, and it would change the amount, that was for Teva, right?
Yes, if we decide to not elect into naloxone from Teva, the amount that we would receive from Teva would go up by about $2 million. The exact number is a little different, but it would go by about $2 million.
Thank you.
So the motion will entertain, will recommend option one. And again, those are monies that we actually have in the bank or the checks in the mail, so to speak, of 7 million, about 7.7 million, just so the people that are joining us via online, and Chris is sending out the document that Krista has prepared. And so we'll give it a minute here, and then we'll entertain a motion. Go ahead and entertain a motion, and then we'll pause for discussion.
Mr. Chair, I would move that we approve the option one budget as soon as the individuals who are joining us online. If you'd entertain that motion once they've had a chance to receive that document.
Second?
Second.
Second from Robin. We'll pause here. And any other discussion in regards to that while we're pausing?
Mr. Chair, if I could just ask if Monica and Gary could let us know that you've received the budget, just so that I know that you've actually got it. Lori's indicated that she's already received it.
Okay.
Yes, I have.
Yes, I've received it.
Okay, so we have a motion on the floor and a second. Any further discussion? All in favor, aye?
Aye.
Same sign? Okay, unanimous. Thank you.
Okay, well, perfect. Assuming that that is the way you were going to go, the last page is a sample breakdown for the year based on that amount. And so on that last page, page 5, it breaks down of budget items, like just overarching categories. And then not the next slide yet, sorry. If that's sharing on the slide, yep. It breaks down by needs assessment, which was already approved at that 1.5 million, the administrative costs from the requests at the last meeting as well, which is already subtracted out of that 5%, so that's not really there. I just wanted to make a note so we didn't forget about it. So that's why it has the asterisk next to it. And then RFPs, if we were to allocate around 5 million, or in responsive grants would just be kind of whatever's left over. And if we were to allocate 5 million, if we wanted to break down by different priority area, what that could look like potentially. And so I used just numbers of, obviously treatment, recovery, and harm reduction kind of services are gonna be the most expensive. And things like prevention, KDAD's funds their statewide prevention efforts for the community coalitions around 500,000 a year, and so that would almost double it. So just thinking in that terms of how I set the numbers, no other science went behind that. And so if we would want to break it down by 6 different categories, we would need to discuss. So do we want to set maybe an amount for a total amount we would want to spend on RFPs? Lori?
Lori?
Just want to say we're going to separate treatment and recovery, right? So we would need to do that on this table.
Yes, that's true.
And I don't know, do you need this breakdown now? Does it help guide the RFP?
Most likely, and maybe we don't want to do it this way. Maybe we just want to separate it as for the whole treatment RFP, we want to allocate this much, and for the whole prevention one, Sandra's shaking her head for those online. Sandra, do you want to speak?
Yeah, so you had said earlier in your conversation that applicants could potentially go across those 3 categories. So if you break down the money, it makes it really hard to do that. So I would recommend you've got RFP 1, here's the pot of money, RFP 2, here's the pot of money.
That would be simplest as well.
A lot of people nodding their head in the affirmative. Any other comments in regards to?
Yeah, I would just agree that that will help to make certain that as the applications come in, we make certain that we're having the biggest impact. We're not just restricting it to this group with this amount of money, but we're picking what we think will have the biggest impact across the state, not based on a category, but on outcomes.
And I will note for those interested, like we were talking about tracking the amount spent in recovery, we hope to ask for at least an estimate at the beginning and at the end of what they anticipate they'll spend by priority area. So that would be treatment, then recovery, harm reduction, and linkages to care. at least at the beginning and the end, so that we can try to at least estimate those numbers of where the dollars went. Given it might be a little complicated if one strategy is across all of those areas, they might have, that's why we're saying more of an estimate than specifics, but if that's helpful for thinking this through too.
I know too that in a recent grant release from KDADS, they said they had $800,000 for a particular service, so I applied for $800,000 and found out that was for everybody across the state, and my portion was $150,000, so I couldn't even do what I proposed to do. So if we do have it, if we don't, I guess if we don't have it broken down somewhat, people will, well, how much should I apply for? Will be a question that people will have, and we probably need to be able to give some kind of answer to that. Because one applicant could take it all, or you see what I'm saying. I think that was probably your rationale behind allocating these funds by category.
Yes, potentially, and again, you're ahead of the game. The next thing is, do we want to set ceiling amounts for individual awards? So once we have this big budget for the categories, how much do we then want each individual to be able to apply for? So
Really
Keith,
do
it's
have
like
grant
you have my notes.
managing 2 SAMHSA grants lately, and they're just, yeah, grants are crazy.
So do we want to start discussion about what we would want to? Oh, Robin, did you have your hand?
Robin?
I had a question for Chris. A few minutes ago, you said we would know in a few months about some of these other settlements. Do you have any idea? Because I'm thinking, when you start breaking this down and the amount is $500,000 and we might have 25 organizations across the state applying for that, that's not very much money. I mean, kind of to his point a minute ago, you make an application and then you get so little, you can't implement your strategy. So would it be reasonable to delay RFP 2 until we knew a little bit more about some of that money? But I guess the timeline is crucial there.
Yes, the timeline would be crucial there. What I can say is that there is, in the KFA currently, more than $7 million available. The idea of the budget would be to kind of stretch that for more years of service than just the spending it all in one year. When we would see money from the new settlements is a hard date to figure out, in part because there are so many technical steps and we are coordinating between 56 different state entities, state territories and districts, plus over 4,000 cities and counties, some of them getting direct payments through this settlement process. So knowing, I don't want to give any kind of date certain when we would actually see those monies. By example, we anticipated receiving money from Janssen and from the distributors around July, and we actually saw the Janssen payment the first week of December. And so I don't want to give any firm estimates on when we would see those money. They would probably be effective for use 2024, to be perfectly honest.
And again, operating with no budget restrictions, is certainly anticipate that maybe in 2 months or 6 months, or if we, this is our budget right now, we're glad to announce that we have another $5 million that we can award. But I think a lot of it is getting started, in conversation with Krista, getting this first RFP out there and make sure that the processes that we have put in place are operating. So I certainly agree with Robin's comment. You start breaking it down, you think you got this big pile of money, and then you spread across the state, and there's not enough to really to make a difference. So I would anticipate that we're charged with making a difference and spending the money, not hoarding it, I guess. So.
And Mr. Chair, if I, not to jump Sunflower's presentation schedule, but I do think that the responsive grant making may actually address that particular concern that Robin, you were raising with respect to the budget issues, because responsive grant making might make life a little easier when dealing with not knowing exactly when dollars are going to hit the account at any given moment.
Lori, do you have a comment, question?
I have a question. what is the time period that we would be asking people to write these grants for? So are we giving 1 year, 2 year, 3 year? Because that may make a difference in what we want to put into each category or what we want the ceiling amounts to be.
Sure. Yeah, we were thinking a 12-month period since this is just kind of our interim strategy while we get that needs assessment to be more informed and strategic with our approach after the needs assessment is done. We thought since it is just this first time around, just focusing on a year to get us started, and then we'll obviously reprioritize based on the needs assessment that we conduct and the results of that, if that's what the board desires.
Okay. Gary, you have a question? Gary?
Can you, okay. You answered it, Pat. We can adjust the budget. My only comment was that we made the decision on the linear allocation of the capital, where you might make an argument that the crisis is so large you'd want to upfront that capital. But today, maybe this is a small step in the right direction.
Thank you.
Mr. Chair, I think we also want to point out that there's a requirement that we actually, the money be spent across every congressional district, right? So, I mean, we have to take that into account too. It's a third, a third, a third, right? Or no, is it not?
A fourth, a fourth, a fourth.
Oh, fourth, okay, so 25%.
Divided evenly, or just that money has to be spent?
I can't remember.
So the math is a little confusing. It's half of the money has to be spent evenly across all 4 congressional districts. There are a handful of other requirements that we do have to take into consideration, the data science driven, but one of the other things that we do have to do is work in consultation with the variety of other groups to just make certain we're not duplicating work. I think right now that, Robert, tell me if you think otherwise, that the utilizing the strategic plan that or rather the needs assessment that has just been produced is potentially enough for the consultation, but I'd love another opinion on that.
I think you're right that for now that's enough. The good thing with doing this RFP, we're not approving things one at a time and having to figure out 11 months in, oh God, that district hasn't gotten anything, and we don't have any grant requests from it. The board can look at all as a bundle, and it can do not only the program and rubric scoring that it needs to assess the individual grant applications, but also can do the statutory compliance balancing and make sure things are distributed as they need to go. And the needs assessment will help guide a lot of that, and the consultation element of it. But that will be the important part, pairing with the responsive grant making down the road, is making sure we do hit those chronological, geographically distributed requirements for the total work of the board.
Yeah, that makes sense. And I will note too that in the actual grants management system, it's not necessarily its own question on like the list that they'll have to respond to, but it is something that they will have to respond to when they're talking about their organizational information, just listing address and those kind of things. We have a congressional district question, so that will be identified in their application as well. So then when Sunflower's reviewing it, we will take that into consideration as well. Wouldn't be they would get priority unless we don't have any applications from one of the congressional districts. We might have to reassess, but that would be something that we would consider while we review too.
Lori, comment?
Yeah, I have a question. So is the guideline that we need to, where the organization is headquartered, that's where the money goes? Or if, let's say an organization is in one congressional district, but their program is across half the state or across all of the state, they want to work in all of the high schools across Kansas. How do we factor that into this conversation?
Lori, the statutory requirement is that 1/8 of the total amount of monies granted each calendar year shall be used for services in each of the state's congressional districts. So it's not, that requirement is not limited on where the organization is located. It's keyed on where the service is provided.
So are we capturing that somehow in the grant application? Because what I think I heard is we're getting congressional district where the applicant entity is housed, not necessarily where they're intending to provide services.
Yeah, sorry about that. I think I mis-explained. I think it is, and we can make sure it is, that I'm pretty sure it's just what services will you be, or what counties will you be providing services to, or what are you applying for? And that will auto-populate whatever congressional districts are associated with those counties they choose. And so it would be those services they're providing across all the counties that they select, then that would identify that district.
For that clarification.
I think going back that the consensus was that instead of separating the funding out into different categories, that we would leave it as a lump sum. And just looking around the room and online, is that the direction that we want to give to Krista? Is that something we need to memorialize? I'll entertain a motion to that effect. Second?
So moved.
Second. Keith and Mike seconded. Any further comment about whether the funding remains as a lump sum as opposed to broad or specific categories? Motion is that the initial RFP 1 is treated as a lump sum as opposed to specific categories. Is that correct, Keith?
Yes, that's right.
All in favor? Aye. Opposed? Same sign? All right.
So do we want to set that lump sum today? And then we would, with that, we would want to determine the potential ceiling amounts to list in the RFP too. So we could list total funding available for treatment and then how much they can apply for under each of those two when they're applying.
Robin?
Okay, I'm still kind of stuck on the conversation about 5 minutes ago. When we talk about how much any individual applicant might be able to get, because I go back to Keith's comment, you apply for something, you build a program, and you don't even get enough money to get it started. And I feel like we really want to make a difference as quickly as we can. So I'm thinking about your comment, Chris. We've got more than that amount of money already. So what do we have now? And I guess my question to the committee is, would we want to consider putting more than 5 million into the RFP bucket this first, because it's a one-time-a-year grant application, right? So would we want to put more in this first time to try to get some organizations kick-started to get some programs moving? Just a question.
So the balance is we got more money in the bank. Do we want to begin with more money versus do we want to get started and then adjust on the fly?
So this is Mike, and I agree with Robin's comment. I thought the same thing initially, but considering that this is kind of our phase 1 of providing some immediate resources to Kansas, that will be followed by our needs assessment, in which time we can be more targeted in how we spend the money. I would lobby for proceeding as is for year 1 and doing that big boost or larger spending in year 2 when we take RFPs based on our needs assessment.
I know, Lori, you have a comment?
Yeah, as somebody who writes and runs a lot of grant programs, I want to say one thing. The reason I asked about the timing period before is it can be really hard to spend money in a year, because let's say the program that you're standing up requires you to hire 1 or 2 people to get started, and just even setting up the accounts in your whatever system you're in. And so you could be 2 or 3 months into your year of funding before you're even able to get started actually doing what your program is going to be doing. And so I hear what Robin is saying, and I'm wondering if there are a couple things. Do we want to say that these are 18 months instead of 12-month grants? Do we want to perhaps to get this money out there into the communities and get things rolling, we could allow people to apply for kind of startup grants that we would then consider in future years. Like this is their kickoff year. We're giving them funding to ramp up, and then there would be kind of a streamlined way for them, if they show results and are able to get started up in that year, to get additional funding in future years. I'm just trying to think of what the practicalities of are getting these grants and how quickly you can spend the money. Because if we say we're going to give somebody $500,000 to spend in a year, I think we're going to see a lot of requests for carryover no-cost extensions.
Jason?
So just to piggyback on that, what will the grant year be? I mean, are we beholden to a calendar year? Is it a July to June fiscal year? What are we looking at? Because, and I will echo my friend Keith, who has had experiences with grants where the grant started 3 months ago. It was awarded now. The contract happens 4 months from today, and I've got to spend the money in 5 months. And that can be a real challenge. So I think that's just a question.
Yeah, I think it would be ideal to, like, whenever we set the start date, ideally that would be after we anticipate being able to get the letter of agreement with them and getting everything in place where they actually have 12 months to spend it. And I think we're open at Sunflower if we want to have the consideration for carryover or extensions if there are circumstances that come up. I didn't know if the board was ready to consider that, or if we wanted to consider it if it came up either. So we hadn't presented information about that, but we're open to suggestions there.
And if I can just pop in, from the statutory perspective, the reporting period for the board to the legislature, the AG, and the governor is calendar year. So I don't know if it makes sense to tie it to the grants to the calendar year. I'm not sure that that's necessary, but that reporting period for us is that calendar year.
I will say for reporting, which is later on this slide too, but we're proposing to, we want enough information obviously to report and to be able to make sure that we're being effective, but we're suggesting maybe a 6-month progress and financial report and then a final as well. And so that might be into consideration if we fall at a weird time with our annual report. Maybe we have to use those 6-month reports to do that, but hopefully we want to make the reporting burden as low as possible with getting the information we need so that they can actually do the work ideally, but also open to suggestions on that schedule.
Monica?
I apologize if this has been mentioned already. Will the actual agreements with the grantees and the payments be with Sunflower or the AG's office?
So I believe the actual contract would be with Sunflower. The payments will come from Sunflower because Sunflower is currently holding the KFAF dollars.
We're assuming that, like with the RFP, it would probably say, you know, Sunflower Foundation on behalf of the Kansas Fights Addiction Board and the Attorney General's office, so that it's not just a Sunflower grant, it is a KFA grant.
Sandra?
So I think part of the compromise here is we know it's 12 months, 18 months. We know it's a designated amount of money, and we have to tell people here's the maximum and here's the estimated amount of grants that we will fund for the maximum. But for 12 months, you know, we probably are going to be looking at folks who have something in the pipeline or are doing some work already, and this is a boost, right? It's an expansion. It's not a complete creation of something. And we have to I would recommend we set that expectation in the RFP, that if you think you're going to start a brand new program and hire 5 staff, this is not the money to do that with. It's how do you augment what you're doing, maybe what you're doing on a volunteer basis, and here's some funding to help with that. So for me, it's setting the expectation versus getting bogged down in how much money are we going to give people to maybe not be able to do anything because it's only a year. Does that make sense?
Yeah, and I think that's been our prerogative, is to, you know, we know that we have some immediate needs and we have some money in the bank, so let's do what we can to deploy. And your point, Sandra, is very well taken of, you know, something that you already are doing, you know, because we all been part of projects, might take several years, and that's where, you know, it starts getting exciting, you know, when we get to that next point. Lori?
I would concur with that. And I wonder if then next year, when we do have we are targeting more towards the findings of the needs assessment, we could keep in mind a way to allow for innovation and new programming. I think that makes
Absolutely.
sense for this year to set the expectation that we're just trying to get money out the door to supplement existing work.
Yes.
I think that's the goal, and maybe it's they already have the capacity to do something they're not already doing, but something that can be done in a short term for this first time, so that ideally, I would assume we would move to longer term grants once we have that more strategic approach and recommendations from a needs assessment. So it might still be something more new, but it's not too much of a stretch for them to do it, and hopefully whatever they're doing might have a little bit of innovation in there, so maybe they're going to try to propose to do it a different way, and it's more innovative than they've done it in the past. Those kind of things.
You need to, go ahead.
Mr. Chair, I just wanted to answer Robin's question about how much is actually in the account. There is approximately $34,400,000 in the account currently, but we have to subtract at least $1.5 million for the needs assessment from that because that's already been allocated. And I would say we need to subtract about 5% of that for just to ensure that Sunflower has their expenses covered. Although that hasn't been addressed just yet by the board, we do need to make certain that money stays for those expenses.
Do you need any more direction than what you've received, or is it clear as mud?
No, I think that's all helpful conversation. I just, do we want to set a number today?
Well, have we already set the number? The 7.7?
Or for the RFPs specifically?
Oh, for specific, the amount.
And you're just looking for one, right? Or you're looking for 1 and 2. I mean, it doesn't matter.
Let's do one, and then we'll get to 2 since it's a little bit down so you're asking the board if there's a maximum amount for the RFPs? And does the board want to set a maximum amount? Go ahead.
So I just did a little calculating here. For 7.7 million, if we did, for $150,000 limit, we could do 51 grants. For $200,000 limits, we could do 38 grants. For $250,000 limits, we could do 30 grants. For $385,000 grants, we could do 20. Now, setting the limits doesn't mean that's what they'll apply for, so there will be more regardless of what we set the limit at, more than likely. So that's just an idea of.
You want to pick one of those out?
Is that 1 and 2, or that's?
That's the 7 point
Oh,
million. So.
I don't
think we can.
We
use
have that much.
7, we have to, because we
We have
need
a
to use
needs
5
assessment.
million, right?
Sorry, those online. Needs assessment was already approved for 1.5. I mean, then if we want to do the responsive, we'd want to probably leave something aside for that too, when Brandon will present that. But yes, for the RFPs specifically. So the 7.7 would include that 1.5 as well.
So the RFPs is 5 million. Yeah, as an example, but again, do the math on, do we want $100,000 grants or 150 or 250? Entertain a motion.
We're talking maximum. Right.
Yes.
Yes.
And I think we also have to figure out, because we've got 5 million for a year. How much do we want to put to RFP 1 and RFP 2? And then kind of drill down to what's the maximum grant per category.
You know, I keep on going back to what the chair had said about, I mean, in another hat that I wear, a budget is really an evolving document. And so this is our initial our initial budget, but we may have more than that. And it's highly likely, it's highly likely that we're going to have more than that. So, I mean, I do think that we set 1 and 2 knowing full well that we'll probably amend that budget. Is that fair? And so it looks like for the sample categories that you gave the category breakdown, to me, it looked like pot 1 or 1 was about 3 million and 2 is about 2. Is that close? I'm not an accountant, but close? Yes. Okay. And, you know, obviously conversation can have, but I am happy to make a motion for a breakdown of, for the grant proposal 1, sorry, I'm getting the wrong words. I know I'm saying what, yes, RFP 1, pardon me. RFP 1 for a maximum of 3 million and for RFP 2, a maximum of 2 million.
Second. Any further discussion? All in favor, aye? Aye. All opposed? And then the next motion we'll entertain is the maximum amount for each of those.
I don't know if you saw my hand, but I think 200,000 max would be a good amount. I think 100,000 doesn't go very far these days. We might get some applications with that amount, but we might get a really great $200,000 application that is comprehensive and addresses a need. So I'm just throwing that out there, 200,000.
Yeah, I think that makes sense. Another thing to consider too is say, if we want to have a tiered approach to the ceiling. So if somebody wants to do a statewide program versus just a city level program, do we want to consider higher ceilings for things like that potentially?
My first thought is, you know, let's not get too complicated to begin with. Let's put the 200, and then I guess in priorities or part of the grade, you know, if I'm asking for 200, that would do the most good over somebody that's very targeted, I would think that'd just be prioritized.
Does it make sense to make the max amounts the same for the RFP1 treatment and RFP2 prevention? My thought is it's more expensive to do treatment. It's less expensive to do prevention, so making the caps the same may not, in my mind, doesn't make sense. Now, I'm not a provider, so I'll leave that to Jason.
Well, no, just a very quick piece of clarification. We're not talking about, we're saying max award, right? Instead of, we're going to do $200,000 awards. 50,000, you can apply for 50,000.
No minimum.
So, which I think speaks a little bit to your question of, I mean, is everybody going to apply for 200,000 for prevention? Maybe, maybe not. I don't know. So I just want to make sure that wording was clear in my head.
I think we were thinking maybe like setting a not to exceed amount to list in the RFPs. And I will agree with Mike, with my experience in prevention, it is a heck of a lot cheaper to do prevention than it is treatment. But the prevention bucket does also include some linkages to care and potentially the criminal justice side. So drug courts or something like that might also still be kind of expensive. So things to consider with that. And I think I see a hand.
Lori, I don't know if you have a question or if you want to make your 200,000 in the form of a motion.
Yes, I can do that. My hand was raised before the last person spoke. I was agreeing with that this is a maximum, not a minimum. So, yeah, I'll make a motion that we set a not to exceed limit per grant for both categories. RFP1 and RFP2 of 200,000.
Motion, a second. Robin seconds. Any further discussion? All in favor, aye? Opposed,
Aye.
same sign? All right, unanimous.
All right, awesome. Thanks all. That makes, I feel like, everybody's life probably easier if it's all the same amount across, so that's great. Any other budget-related questions before we move on? And this same slide we've been on forever, sorry all.
Keep moving.
Okay, sounds good. So I'm glad we got through all of that. Next thing related to budget, I guess, is listing in the RFP, we have funding exclusions. Obviously, this funding is a little bit more flexible than most funding out there, but we did include things like legislatively required, so obviously we wouldn't be able to fund for supplementation, not being able to supplant any funds. Non-abatement strategies, opioid litigation, I assume, is one of those things, and then things like campaign contributions. Are there other things that the board would want to consider excluding?
I'm in favor of current law guiding this. Lori?
I know that we have found there are a lot of restrictions in other grant programs for like, capital, like to purchase a house that could be used as a recovery residence, or to purchase furniture or other equipment like that. And that actually is a problem, because if you can't find any funding to do that, it's hard to expand your services. So I just wanted to ask, is that what current law includes here, or is that not? I would advocate that if we can allow for that, we should, because
Yeah,
I don't think you could get that those other places.
I think we want to be open, or my opinion is we'll be open and let the process, again, we don't want to run afoul of what's out there, and we won't. Got two attorneys in here. I don't know if we need any more than that to make sure we don't get outside of the line. So when we get to the innovation process, if there's brick and mortar houses, whatever's going to save lives. So
okay, great. Thank you for that clarification.
We can move on from there.
Okay, great. If nothing else, we can.
Mr. Chair, I can just ask a quick question, Krista. I didn't hear if the board made a choice on this, but are these grants going to require spend down over the whole life of like over the year period, or can they hold the money and continue on to another year? I'm not sure if there was a clarification on that point.
Yeah, open to board discretion. We were thinking that we would recommend it be spent down for those 12 months, but then if there was something that arose, like they couldn't spend it, maybe then we would talk about some kind of extension, but maybe the board wants to set that in advance and has another idea.
Robin?
I think it'd be good to set it in advance, so as they're thinking about what they might apply for, and just thinking there's going to be unforeseen obstacles to getting this done, I would go ahead and put in a clause that they can request extension.
And especially at this first phase, we want to make an immediate need. So if you're can't hold on to the money for, oxymoron, I guess, immediate and next year.
And the reason I asked that question is just to be clear, there's nothing in the statute or the settlement agreements that require spend down in any given period. There's just the requirements that we report any spending that we are doing.
I would anticipate as we move into the innovation that we'd have more leeway and more allowance for that.
So as a point of clarification, so if an individual or a grant comes in, a grant request comes in for $200,000, and we award that, they don't have to spend $1?
No, they do. We want them to spend it.
But they can get an extension if they haven't spent $1. I mean, do we have an amount? I mean, do they have to spend 50% of their grant allowance? Do they have to spend, and what I'd hate to see happen is that we award a $200,000 grant, and then the next year we award another $200,000 grant, and we're stacking up grants, but money isn't being spent.
My feeling about it is that it needs to be spent.
I think that would be the goal, anticipating, like in the RFP, it's, it's expected that you'll spend it in these 12 months, and then maybe there's just a little clause that some exclusions may apply, or something along those lines.
The thing I'm thinking about is I know how hard it is to hire people right now. So you may think, well, I can get this, I'm going to do this program, I'm going to fill this position, and it takes 3 times longer than you anticipated to hire somebody.
But again, that's up to me when I'm making that grant. Again, I'm making my comments, so please pipe in if you got something else to say. But I need to take that into account, and the second asterisk would be, subject to clawback. If I say I'm going to spend it in the next 12 months and I don't spend it, then it comes back into the bank and we redistribute it.
So
I'm in favor of
I-
unforeseen. I think there's unforeseen circumstances that you can't control, but
I'm thinking that Sunflower probably has processes for this in the other grants that you make. And probably just follow those policies. And I mean, that's why we hired you to manage these grants. We're just making policy decisions. So,
Could I jump
Lori?
in here? I was going to say, I really agree with what Krista said, that we should set the expectation that funds will be expended in a year. But if COVID has taught us anything, we have no idea what's going to come in the next year. So I think having some clause that says, if there are extenuating circumstances, extensions will be considered on a case-by-case basis or something like that would be appropriate.
Monica?
I agree. I defer to Sunflower's guidance and their great experiences they've had to get this done and get the money on the street, but take into account things that do happen.
So would you suggest a motion to that effect, Robert?
If the board is providing Sunflower direction to set a standard of an expectation for spending within 12 months, but allowing for exceptions and extenuating circumstances, then yes, I would make that a formal motion by the board.
Motion by Sarah.
thank you, Robert, for voicing my motion. I'll make that motion.
Second. Any further discussion? All right, all in favor? Aye.
Aye.
Opposed, same sign. Thank you. Oh, Keith.
so one other obnoxious thing I read in grant applications is, how do you plan to sustain this after the grant money's gone? And so I hope we don't have any statements like that, because there's no alternative or we wouldn't be applying for this grant. So I hope.
Amen.
We definitely have it in there, but I'm happy to take it out.
Well, if, Mr. Chair, if I can hop in here, this is one of the things where the statute does have a very specific requirement that the board has to consider the sustainability of a program after the grant funds are exhausted. So unfortunately, I do think we have to at least have that consideration as part of any grant allocation.
And not to argue with Keith, but I'm going to, I like the idea, if this is permissible legally, is to make that part of the grant acceptance. So if we approve the grant and you're receiving it, that is part of your commitment to develop a plan for sustainability. And the reason I say that is because in my work professionally, anytime I've received a grant, I have to go before the Board of County Commissioners and seek their approval to receive the grant. And I love to say to them that this grant is for so long. In receiving this grant, you're going to work with me on a plan to sustain this program. So I've just, in my narrow world, I found that clause helpful with my people who are making the choices about money.
So in my 32 years working with county commissions, they don't care when I tell them that. And they don't commit one commission to the previous one. And so I just find it, with these grants, they're going to do time-limited things. They're not going to start sustainable programs on money if they don't have a sustainable process. But if we're going to eliminate a lot of good things if if we have that expectation, they're going to continue it into perpetuity. It might not be something either that even needs to go on past, a particular year. Maybe someday we won't need everybody to have a vial of naloxone in their pocket. But let's hope,
Mr. Chair, if I can actually respond to that. The statute doesn't say that the program has to be sustainable, only that the board has to consider the sustainability of the program after the exhaustion of the grant. So if it is a temporary program, the board just has to consider that it is a temporary program and will not continue past the grant.
And I'll read the question as it is in the grant application right now. It says, please tell us your plans for sustaining your project after the grant period ends. As a result of the grant funding, what will be sustained, enhanced, or expanded? So it's just kind of share more details, which probably will say, we're going to apply for more grants, but we'll see what people say.
Ms. Monica, I can live with that.
That's those grants where that's the section that I make stuff up that typically.
All right. We got about 15 more minutes before we break for lunch. We'll basically break for about 10 minutes and grab your box lunch, and we can keep working through lunch.
Okay. And hopefully sustainability becomes more reasonable when we get into the more strategic approach after the needs assessment for programs. So next were the standard evaluation metrics. So we have broken them down as metrics, basic metrics that are required by statute that would be collected by everybody. And then also we would use their SMART objectives that they come up with in their application to have unique indicators that they would be tracking. So for the overall, we've started with a list of a detailed account of funding spent on approved uses. That's one required. The services or types of services that they provided, numbers served, and potentially de-identified demographic data. I know that gets a little bit more tricky when you get into things like prevention. And then summary of impact, successes, or challenges experienced. So kind of basic reporting there, and then reporting based on their SMART objectives that they set themselves. Are there any other reporting indicators we would want to include in this, the RFP for them to consider when they're applying?
Looks good.
I would only comment, let's not make it too burdensome, because for $200,000, if you're spending all your time collecting data, right, Jason? You're not going to do it.
Yes, that's what I want to avoid. No GIPRA. I see Lori's got her hand raised.
Lori?
I would 100% agree with no GIPRA. No GIPRA. I was just wondering, those that you just read really quickly, are those listed in one of the documents you sent? I was trying to scan.
Yeah, they're listed in the RFP itself under, I think, reporting requirements.
I believe that's page 8.
So they're pretty basic, but I didn't know if the board had any, issues they wanted to include. Okay. Sure. Just for those that might be unaware what I mean by SMART, since I've been really good about not using acronyms up until that point. So it's specific, measurable, attainable, realistic, and time-bound. So something that we know that they can actually measure and track, and it's a feasible kind of goal. Next item, reporting requirements. We kind of already talked about that, but we're thinking financial and progress reports would come in a 6-month interval, and most likely payments would be associated with that. So we would determine that by grantee of how much they might need up front versus later. And so their payments schedule would be based on their need for those kind of things on an individual basis. And then we've also explored potentially having a small amount of it at the end for the receipt of their final report. They'd get 2 or 5% at the final after they submit their report. Things like that we've done at Sunflower in the past. And of course, those would also have their grantee responsibilities and whatnot. All of that would be outlined in their agreement. And then we're also going to be doing grant payments and all the reporting electronically. So that will streamline the process. And then we're thinking for Sunflower, we're hoping that we might be able to have some kind of reporting dashboard, at least to start, something that might be good to share with the public of data that it would be number of grants made, amount of funding awarded total and maybe by priority areas, so we could say treatment versus prevention, and then the organizations or locations funded, but not exactly the amounts that they received or what, that kind of level of detail, just a general thing so the public could see. And then once we get our first round of reports from grantees, we think we could have a more detailed dashboard developed to where we can report to you all and maybe use those for our annual reports and whatnot and see how we might hone that later. So just something that we're thinking about to share information publicly, and then also how we'll be able to share information with you all and annually.
Sounds good.
Thoughts, comments, questions? Okay. So then the next slide, finally, the next slide is just an example timeline, just to, as a visual of if we were to release the first RFP early March, what the timeline might look like that. And so if we closed it to late April, we could, open RFP 2 at the same time. Maybe have a little bit of a gap so that we do have a little bit more time for lessons learned. We'd host those informational webinars a couple weeks after we release it. And then in May, we'd be able to review and select the grantees. Hopefully it would align with one of these meetings so that we'd have time to review them and bring them to you all at that May meeting. And then June, we would close RFP 2, and June and July is where we would be able to review and whatnot, the other applications. And is there a hand? Lori?
Are we putting a cap on the amount of F&A that people can request as part of their grant application?
I'm not sure. What do you mean by that?
Explain S&A.
F&A, fiscal and administrative. So like when I get a SAMHSA grant at UMKC and it's under training and technical assistance, the university can get 8% of the total grant to go towards paying for phones or paying for the space that is occupied by the people who work on the grant, et cetera. For research grants, it can be up to 55% of the grant.
Yeah.
Then there's other grants that it's 33%, and that's UMKC.
Sure.
So are we doing that here? Capping it?
My opinion is no. Simple is better, but you guys do this for a living if you think there ought to be something.
Most grant applications are 10%, maximum 10%.
I would recommend we have a cap. So 10% would be great.
All in favor of, I guess, a motion for 10%? Yeah.
So moved.
Robin, second? Second? Any other comment? All in favor of a 10% cap for administration? Aye.
Aye.
Opposed? Same sign?
Okay, I'm guessing you mean like an indirect rate. That's what we're thinking. Yes. Okay, I just want to make sure that I'm
Yes.
understanding right when I wrote my notes.
Yes.
Okay. Great, thanks. So the next slide is just the RFP review, which maybe we won't dive all the way into today. We've talked about most of the components where we still needed questions answered, but all of the red items or highlighted items in yellow are the items that would need to be revised. A lot of them are related to dates, and whenever we would want to release it, those dates would change. And then we had one about the release of litigation rights and having a form for that, and Chris thought it would be good to just go ahead and be safe and request that from everybody, like they did from the municipalities, so that is already black in normal font. And then the other things you've talked about today, like a ceiling amount and whatnot. And so once we have that information, we can go back and revise the RFP and those things based on that. And since we are running lower on time, would we want to set a release date at the February meeting, or would we want to do that today for the treatment grant?
I don't know if it makes any difference per se. I'd just soon probably wait till February, but.
Yeah, I think we could be ready to go because we don't have too many revisions based on the conversation today. Brandon?
Am I on now?
All right, sorry. Brandon Skidmore, Sunflower Foundation. So if the board would like for us to proceed with the development and then release of the RFP, you could have a motion that would include that. Typically, when we do an RFP on the Sunflower side, that's how the board proceeds, is they've reviewed the content, which you've reviewed today. They've provided their feedback. We incorporate that into the document, and then we release the RFP as our systems come online and are ready to go out. Then we would report back to you in February, of course, whether that RFP was released or if we're still working and what our projected timeline is for the release at that point. To Krista's point, I think we're pretty close. We have some internal things that we're still kind of going through. And then, of course, we would work with the Attorney General's office on the communications component, which Krista reviewed earlier.
Entertain a motion, if that be the will of the...
Mr. Chair, real quick, there was conversation about some individual board members working with Krista about some of the categories within the RFP, and that would include breaking things out between treatment and recovery, adding some new potential categories. Any motion would need to include accounting for changes that would be made, assuming the board doesn't want to approve the actual RFP following those changes in February.
So...
I'll make it simpler.
No,
the choice would be either to, you could give the motion that Brandon talked about to release it when it's ready, and then they have what they need, but then there's no further board approval of any alterations to the draft RFP has given today. It would just be up to the Sunflower Foundation, the discretion granted by the board after getting input. The other option would be to wait until February to approve releasing the RFP once the final RFP following that input is drafted and presented to the board.
I'll add to that, so we could revise it and come prepared with our ideal timeline at the February meeting and have it already in the RFP, and then when you approve the RFP, you could then be approving the timeline too, if that works.
Sounds like the better option. I think somebody like to offer that motion. Oh, don't need it. Okay. We're going to wait till February.
Okay, and it looks like lunch isn't here yet, but the next area of focus was the responsive approach and what that might entail. Brandon, you want to take that away, or do we want to wait to start that?
Let's break for restroom, whatever, and then if the boxes show up, you can grab them. We'll get started, and we'll go from there. If they're not here, then Brandon can get started. So we'll plan on being back here in 10 minutes at 10 till 12. learned how to be the best chairperson from was a guy from Leavenworth, Kenny Wilk, and when we started getting pressed for time, he would tell the group to be pithy with your comments. I don't know what pithy means, but I think it means to get to the point. So we'll work on being pithy here over the next hour. So are we ready for Brandon, I think? So Brandon, if you want to come to the mic. Welcome.
All right. Thank you, Chair, and good afternoon, I guess, to board. And for those online, Brandon Skidmore, Sunflower Foundation. So if you're following along in your packet of papers, this is the document that's titled Kansas Fights Addiction Framework for Responsive Grant Making. And then we have a couple of slides that go along with this. So great discussion this morning related to the 2 RFPs that will be developed and released here this spring, and a great start in that work. From our side of the grant-making world, we wanted to kind of do our due diligence with the board and bring to you kind of a full picture of grant-making strategies that you can consider. When you think about the amount of dollars that this board is allocating on an annual basis, it makes you one of the larger philanthropic boards in the state. So not only considering kind of the content and programmatic components that you bring to this work, but it's also probably important for you to consider the various grant-making strategies or levers that you can deploy to move dollars out into the field in a variety of ways, RFPs or requests for proposals being one of those. So as we get into the slides here, the next slide, I wanted to just kind of break down, the 2 primary components that you see in most grant-making strategies within philanthropy, and that is a strategic grant-making approach and a responsive approach. As we've been talking, it's easy to spend money, it's hard to invest it, and so as you're looking to invest these dollars with partners and communities, it's also behooves you to look at kind of how you can move those dollars to partners and the work that they're doing. RFP, the 2 that we talked about today, for the sake of time and kind of orienting ourselves, would really fall into the column of strategic grant making. You are taking focus areas and strategies that have already been developed and vetted through a very formal statewide process that engaged a lot of partners in weighing in. And that framework that you're using to guide these RFPs are asking community partners to respond to very specific things. I'm going to work on these focus areas. I'm going to pick these specific strategies. I'm going to invest the dollars you're giving us to do X, Y, and Z within that framework. And RFPs are a great way of moving dollars to communities and keeping track of what you want to focus on in a very strategic way. But there are also things to consider from the standpoint of what happens when you have opportunities that don't fit into a defined RFP process. So really what responsive grant making on the yellow column there provides you is some flexibility as a board to think about how you would deploy funds. And so in a responsive grant making approach, you're really working with partners on a one-on-one basis to develop a proposal that fits a specific need that the board is wanting to address. And those programs and services and opportunities come through a variety of ways. They can come from work that that's going on that needs additional attention. They can come through ways that the board engages with partner organizations and hearing from them. They can come to you through public comment, informal public comment sessions that the board might want to consider holding as you kind of get into your work. So when we're looking at a grant making strategy, our recommendation to the board is to develop a multiple pronged approach for how you're allocating dollars or the mechanisms that you use to put dollars into the field. And so this first slide really shows and kind of breaks down some of the differences between those two categories and some of the opportunities that you have in both of them. The next slide, and we can go to the next slide, is really looking at, is it one, the other, or both? And in our experience, our recommendation is that you take a both perspective. The gold standard in philanthropy and grant making really has moved to that both category, which is not just providing a scheduled RFP in June and one in December, and that's what you put out on an annual basis, and it's very defined, but having that kind of structure, but in between being able to fill in and be responsive to innovation or new needs or gaps, it allows you as a board to be more nimble than what just an RFP would allow. And that responsive grant making can also provide you, based on some of your discussions earlier today, the opportunity to kind of look at where dollars are falling, the discussion around congressional districts and how those dollars are being deployed. So you're not stuck with just within an RFP formal process, but you have the ability to kind of be nimble and react to what you see. Also, as the board gets into its work of hearing from partner organizations, and I know Chris in the AG's office has a whole list of individuals and groups that want to present to you as a body and talk about different opportunities. As you hear those things, it also gives you as a group the opportunity to say, you know what, that is something that we probably really need to look at. Why don't we pursue something there? And that's going to be outside of an RFP process. Maybe you become aware of a huge data gap in the systems that exist across the state, and you want to work to fill that gap through a more responsive process, where you're inviting the applicants who can actually do that work into a process and asking them to provide you a proposal for doing something specific. So when Krista was talking about how you want to balance your annual allocation, she was talking about what would you maybe want to allocate to formal RFPs, and maybe what would you want to have available to you through a responsive mechanism where you can pull those grants or those opportunities when they become available or when you think you need them. And again, then also provides you that balancing approach to, as you're looking at how you're spending dollars, where you need to allocate them if you need to do work in certain areas or certain parts of the state. Just kind of for background, because I think Sunflower provides kind of a look in to see from our side of the table how our grant making works. The vast majority of our funding right now is responsive funding. And really, when you look at funders, the longer that they've been around providing dollars, typically the more responsive their grant making strategy becomes. Not that we don't do RFPs, because we do, but when you look at kind of that balance there, we're certainly heavier on the responsive end than we are on the RFP end. And that makes sense given the fact that we've been around over 20 years. So as you as a board develop those professional relationships, you get to know intimately the needs, not only in your own specific areas, but across the state. Responsive grant making could become, in some years, heavier than sometimes your RFP grant making, depending on what you're trying to do and the needs that you're trying to address. So from our perspective, as we support the board, we wanted to make sure that you were aware of there are more mechanisms for you to consider in allocating dollars than just a very formal RFP process. And I know as Krista listens in on the state calls as other states are getting ramped up to do this work, one of the things that is kind of coming up through those calls, percolating through those calls, is the bodies that have been put together like you in other states are really struggling to get traction on how do we do the nuts and bolts of the actual grant making. Like, how do we put this money into a framework and then move it to communities that they can respond to, all in a way of hitting all of the things that we have to hit, from reporting and all the mechanisms that are required for constant, checking in and all the processes that go along with that. you know, as you had a great conversation on grant making earlier, and you're hitting on all of the things that we deal with on a daily basis, that we have full-time staff that's their job to handle. How do you handle grant extensions? How do you handle the fact that a grant got going 6 months and they lost all their staff and now they're on hold for 3 months? Our approach is a very flexible approach, and I think as you've also talked about your reporting requirements, it hits on that as well, which is we're intentionally not a federal grant-making body, and we don't have all of those hoops that we're causing folks to jump through, and that's the opportunities that you have, is to kind of set that opportunity where you're getting what you need, but you're structuring it in a way that's really responsive to the communities and to the organizations that would be applying. And some of Keith's comments earlier about sustainability hit right on those particular points. So as you look at the requirements that are laid out for the board to consider, all of the things that you talked about as part of the RFP, eligible expenses, eligible applicants, how the grants would be set up and worked, all of those things would still apply to responsive grant making. You would still look through that exact same lens around due diligence to put these grants in place. So nothing changes from that perspective. We're still balancing all of those requirements. It just gives you a little easier process of allocating funds instead of developing a formal RFP every time you want to do something. So we wanted to put that out. As you've looked at that, certainly willing to answer any questions that you might have, and not just today, but probably later on as you get going on this. You know, from our standpoint, you know, our recommendation is if you want to pursue a responsive grant-making strategy, that's probably not something that you have to do right away, right out of the gate here. Giving yourself some time to get these RFPs in place, get them into the communities, funding them, getting them going. Those are all things that would probably take priority over also than trying to stand up a responsive grant-making approach. But certainly something to consider as you kind of move through the end of summer into fall. And that's also another time for you to kind of consider what your process wants to be, what you want the process to be to engage partners. So as you kind of carve out time in your board meetings to hear from partner organizations around things that are pertinent to what you think your priorities are, as well as times where if the board wants to open up for public comment to hear from just individuals on what they feel should be done or not done as it relates to expenditures of these funds, that's something else to consider too. And we're happy to work with the AG's office on kind of pulling all of those partners together, kind of making sense of like what is it they're wanting to present on, making sure that they're up to speed on what the expectations of you as a board are in terms of hearing presentations, making sure we do the due diligence of getting, if they're doing PowerPoints, getting those ahead of time. So laying it all out to where when you're hearing from partners, it makes sense, it's organized, and maybe looking at the content of what you're hearing from partners and scheduling that in a way that it's hitting on specific things that the board's wanting to consider or work on at that time. Maybe you want to take a few months and just hear a lot of presentations about data and the availability or the barriers or access. Maybe another couple of months you're wanting to really hear from people that are in the treatment space or what have you. So those are things that we can kind of help you think about. But as you start hearing from these folks, the responsive grant making strategy might come in useful as you think about, you know, other ways of funding outside of the RFP. The actual write-up includes a recommendation. I don't think it's a recommendation that you have to act on today. It's really one of, would you like us to, start putting together a framework for how you would start bringing in partners at a later date to kind of hear from them. And also, it included the opportunity for Sunflower to develop an application within that electronic system that you would deploy when you want to use a responsive funding, that responsive funding mechanism. So since it's not time sensitive, I don't think that there's anything that you have to act on, but it's more about thinking about reacting to and kind of stewing a little bit on kind of how you want to put dollars into the community.
Thank you, Brandon, and we want you to stand for any questions or comments that there might be, but certainly in discussion with Sunflower, taking upon the wishes of the board from our first meeting of wanting to be dynamic and responsive and those things, so very much feel like the, dual grant making that we spent time on this morning, plus also with the responsive. And as Brandon mentioned, we can think about it, stew about it, and then they have lots of experience, which is fantastic. And, we have lots of needs, lots of organizations that are, going to be wanting to present, so we can develop a strategy in that regard. Being sensitive, it's not like this is our primary job and everybody's got things to do, so we want to be sensitive to the board as we go forward, but also sensitive to the public. So with that being said, open up for any questions of Brandon or comments. Well, Robin?
I love learning about this because I think will give us so much more flexibility, and I hate hearing a good idea and saying, oh, well, you can apply for that next year. Yeah. So thank you for this.
Sure. And we will, maybe at the February meeting, just kind of, we could even appoint a subcommittee to work with you, Brandon, on developing a specific responsive grant-making strategy.
Yeah, I would just like to say, too, I think it's a great idea. It's a great strategy. I know that there are a lot of even state departments working with providers across the state to implement various programs and projects that are always capital shy or something. And so being able to help fully implement something, with a Cadillac or Lexus plan rather than a Chevy, that's
right.
That's always ideal. So I like the idea. So.
Thank you, Brandon.
Thank you.
I do drive a Chevy too.
I think we can, again, this one's not as time sensitive as those RFP kind of discussions were, so we don't necessarily need to have an in-depth discussion about it, but we can go to the next slide, and probably the next slide after that one too, and just jump right in. So we developed a framework for what an initial start to what a needs assessment could look like. And so in there, we started with the key assessment questions of what gaps exist within our Kansas substance use disorder systems across the lifespan and continuum of care. How successful or impactful are the state's current investments in this work? And then what innovations are needed to transform the behavioral health systems of care in Kansas over the next 18 to 20 years, or however long we ended up wanting to look at. And so that's what we were hoping that this needs assessment would accomplish and help guide our more strategic, innovative, and longer-term funding strategies once we have the results. Another thing I learned from what Missouri just recently did that we might want to think about at the tail end of our needs assessment is getting together the group of all of the SUD-related funders in the state and having a strategic planning session. Missouri did that, and so they determined like this state agency was going to do this in the next 2 years, and this would be doing this. And so with their settlement dollars, how they could all work together and fill gaps, that might be something we consider too later down the road. And they don't have a report out yet, but they should at some point. We were going to look at that and see if that's something we would want to do too, but it's something to consider. So with this needs assessment, of course, we would want to include all of the existing data and reports and recommendations that exist in the state, but the primary focus on what the dollars would need to be spent on would be that new data collection and diving into more intensive questions and then just integrating in all of the existing data too, so it is one comprehensive approach that's looking at everything and considering all of the things. And I think we've mentioned before the early childhood needs assessment that was done in Kansas is pretty close, very similar to that. But of course, this would be larger scale, most likely with the number of stakeholders that would be there. And we assume that this, I think we kind of mentioned it too, might be up to a year. It could be a lengthy process if we're really going to get a vast amount of input. And ideally, they'll look at not only just our state, but maybe see what other states and countries are even doing to find if there might be something helpful for Kansas as a solution or a more innovative approach. So it wouldn't just necessarily be Kansas, but it would integrate some kind of potential recommendations, I guess, on what others are doing too. But obviously, we'd primarily focus on data collection related to Kansas stuff. So then on the next slide, we are talking about the vendor or grantee, whatever it ends up being, considerations and requirements. So we're thinking it would be best to probably release a separate RFP for the needs assessment. So as we continue to hone in on what we want this to really look like, we could then develop an RFP for different agencies and entities to apply for and for us to consider. We would obviously want them to have some experience around the Medicaid system, our mental health and substance use disorder systems, our SUD priority populations. This is all just in that framework, so it's kind of just a high-level overview of that framework I should have mentioned at the beginning. We'd obviously want them to comply with all of the privacy laws that they have to, HIPAA, 42 CFR, Part 2, those kind of things. Experience with having state-level needs assessments and having the organizational capacity to do so, because it will probably be pretty time-intensive and staff-intensive to do something like this. We're also recommending that when we do get to that point, we think about allowing that grantee to contract with third parties. So it might be they want to get data from Beacon Health Options, but it's going to take a lot of time for them to pull it, or maybe they need resources to do so, or same thing with KDHE or anybody. There might be pieces of the needs assessment that they might have to contract out, so allowing them to be able to do that if they need to. Or maybe they don't have the experience in one of the areas that is needed and they work with somebody that is an expert in that area, so something to think about there too. Again, nothing to vote on today, so don't, nothing's set in stone, but just to start the conversation and thinking about it. The next slide is just the primary goals. So better understanding the gaps and barriers, obviously, but identifying where those existing efforts and current funds are not adequate to meet the need or those desired outcomes, seeing what those grants, like, you know, are the block grant objectives actually accomplishing what they set out to do? Or are they effective? Those kind of things, if we can get that level of data, of course. Highlighting opportunities for innovation and, of course, keeping equity and all factors at front and center throughout. So we'd hope that that vendor or grantee would deploy a variety of engagement tools, interviews, focus group surveys across the state to be really representative of the state, but then across audiences and disciplines as well, making sure we have lived experience and then all of the different disciplines and feedback from them. And there might be a public comment component, maybe we might want to consider that, and then they could analyze that in the broader sense if we wanted to do something like that. And then the next slide is just kind of an overview of all of those different just sectors. So hoping that this would look at anything and everything. So from early childhood and early prevention to where there likely may not be any issue yet to all the way through, you know, recovery and maintenance and policy and finance, all of the things. So looking at all of the different disciplines and sectors to really assess the full continuum and where those opportunities might lie. And all of these things are in the framework document as well. I have all of these categories listed on this slide have their own set of bullet points of potential things that the needs assessment might include. So that 12 or 13 page document, I think, 11 page document is mostly bullet points of what a needs assessment might include under each of those categories. And it's a lot. So I would assume at some point we'll have to go through and prioritize and see what we would really want to include in there. I just started with a list of things that gaps in information I already know exist, things that have come up in these meetings, things that have come up with the state, different just conversations, and that's where those have come up with as well. Chris, I see you're ready to say something.
Yes, sorry to jump in here, but the one point I wanted to clarify was on the RFP proposal there, the board has already granted Sunflower these funds, so were you suggesting that Sunflower would do its, like an internal RFP, or have the board have oversight? Because I believe because Sunflower has already received those has already received a grant for those funds, the board would no longer have at least that level of control over the money, especially since the money can only go to a qualified applicant, Sunflower being the qualified applicant at that level.
Good question. I was thinking the board would help with that, but I think it would be fine either way. I think it would be really important at the very least to have you all help guide the framework that then leads to that RFP and whatnot too. Does anyone?
I believe the wish, if I recall, was for you to take direction, which you've been getting, and design this RFP and the processes and things, prioritizing, and then bring that to us for, not a rubber stamp, but for us to stamp. So we've already abdicated the authority and granted the funds to do that. So I don't know, Chris, it's from what you're saying, they're not required to do that, but I'm sure they'd feel better. And so I don't know if we need to redo anything that we've already done, or any other comment from the board or Chris.
Mr. Chair, yeah, the only concern is that the board could not grant, no action of the board can grant those funds to a third party who is not a qualified applicant. If the money is granted to Sunflower, they can do the program to develop this needs assessment, but the board cannot take action to grant those funds a second time to somebody in response to an RFP.
More in consultation, I think, is, in direction is what I'm sure Sunflower would appreciate that, but it wouldn't, we've abdicated or the money's yours to spend. I don't know how to say that. And just, it seemed like it makes sense for them to consult or, ask for our input, but not that would carry any weight. Is that?
Yes, and unless, Robert, you have a different interpretation, but I believe that would be fine. I just want to be clear that it's not the board issuing that RFP.
Okay, yeah, that makes sense, but I think we can get input, right, for the board to develop the RFP and what it includes, right?
Yes, the board can still provide input as much as they see fit, because the Sunflower is contracted to support the board. It's just this is just I guess a minor technical point, is that the board cannot direct you to contract with someone in response to the RFP, as that would effectively be the board granting those funds to potentially a non-qualified applicant.
Okay, great. That makes sense. And I think my biggest point is that I obviously don't want it to just be my brain on paper for whatever this includes. So not only would I like to have further conversations with all of you during board meetings to hone in on what we actually want to include in that needs assessment or that RFP for the needs assessment, but also we were wanting to ask you today if we can start meeting with non-state level stakeholders. So to this point, we've not met with any non-state or state level stakeholders. So we've met with like the Kansas Prescription Drug and Advisory Committee and KDADS and KDHE and asked them kind of questions about needs assessment stuff, but we haven't gone to any like local subject matter experts or anything like that without any approval from you all. So we were wondering if we would be able to do that. So getting all of your input and then also others in the state that have some expertise in the different disciplines to provide some helpful information or input onto what might be helpful in a true needs assessment and like questions asked. Sandra?
Hold on just a minute. Robert, do you have a comment?
Yeah, I just wanted to provide a little context. The state level parties you're talking about were entities, I believe by and large, named in statute as required consultants in the process. There is no, I don't believe, baked in restriction on saying they're the only ones you have to consult with. So that's statutory compliance, but it's a floor, not a ceiling.
Right, okay, that makes sense. I didn't feel comfortable without you guys saying, yes, you can do that, for me to do that. So.
So, Krista, my only feedback would be, we've done a lot of these needs assessments in the state, and even the Governor's Behavioral Health Services Planning Council and all the established groups, there is an expectation that people with lived experience have voice. And a lot of times, the people with lived experience are us. So we have this dual hat, right? And so I would hope as you're going out to vet more information about how to frame this needs assessment, that there's some clear intention to go to true lived, not that we don't have true lived experience, but the people who aren't in the business, decision makers, to find out from them what's been missing all along versus what we think. And that's really hard to do, especially in the substance use world, but how do you talk to people who might be sitting behind bars right now, or folks in treatment, or folks in the recovery community? Because they're the ones we're trying to help. So how do we do that intentionally?
Mr. Chair, if I can just add one bit of comment to that. The AG's office has also received many comments from people in the public requesting that we involve both people with lived experiences and people who are practitioners in this space in the conversation about how the funds will be used and the goals of the board.
And I know you're saying in-state. I know there's some gray or quasi, or maybe it's black and white on you know, using people in state versus out of state. I mean, we certainly we're not excluded from, you know, if there's subject matter expert in Minnesota or Italy or whatever, I assume we can get the best.
Yeah, I think that makes sense. I was just thinking for the development of the needs assessment or have any of those kind of conversations, if we went to a state level stakeholder that might eventually be a grantee from one of our RFPs or something. I didn't want to reach out to anybody that could fall into that bucket without getting approval from you all first, because who knows who might end up funded later on down the road for sure.
Thank you. Lori?
I really appreciate the comments about involving people with lived experience, and I might even take that one step further, is that this is really targeting the opioid crisis, and so we might want to specifically make sure we're talking to people with lived experience of opioid use disorders, because there can be differences in how they've navigated the system than people who primarily present, for example, with an alcohol use disorder, especially in terms of stigma.
Yeah, for sure. Great point. And I want to clarify too from you and Sandra both. We're thinking that we want to engage people with lived experience before we develop the RFP and during the needs assessment process for whoever's doing that, right?
What you were saying was how to gather information to help create the best needs assessment process possible.
Yes, so both points, yeah. Okay, just want to clarify, make sure.
And there's certainly some effort nationwide in that regard and gathering that information. There's organizations that have been doing that. I know from a personal standpoint, I've been involved with some of those. And also, you know, a great resource when I was in the legislature is the National Council on State Legislatures that gather information like this, you know, from, I think I had the greatest ideal and then, you know, find out from this clearinghouse that, oh yeah, you know, North Carolina did that 3 years ago and here's, you know, all that you need to know right here. So anyway. Okay, any other?
Is the board at least okay with speaking to non-state level stakeholder? Do we need a motion for that since it's not? Okay.
See just a lot of people nodding their heads. I think we'll just go forward.
So this isn't something I'm real familiar with, but we're certain that there are companies out there that do this kind of work professionally. I guess I've just never been exposed to them. So we know we'll get some competitive bids and more than one.
Especially at the government level. When I was at Commerce, this was like every week.
Okay.
Yeah, that's my hope. I don't know a whole lot of outside of at least just like mainly just the prevention system within Kansas. But yeah, I'm sure there are a lot of entities out there, not only in Kansas, but across the board.
And the price, I have a daughter that actually, she's over in Europe, but she does this. I mean, I think $1.5 million is a lot of money, but she acted like that was, you know, kind of at the low end of what they do. So, yeah.
Okay, so that's helpful. I think that's all I had for, I think, the slideshow and the needs assessment. I think we'll just continue to have those conversations and just develop it as we go. Hopefully within the next few months, we might have a better idea of a framework to release some sort of RFP and start the process. But I'd like to just get everyone's feedback before we do something like that.
Thank you very much. Thanks, Krista and Brendan, for Krista and carrying the water, and Brandon filling in, and Sunflower, and I just continue to feel fortunate to have them as partners as we go forward, and we'll provide a lot of stability and look forward to doing a lot of good things. right now, as far as our next meeting, and then to discuss a little bit about getting, a set day, a specific day during the month, so we can set our calendars for a little bit, and I guess we'll be dynamic in that regard too. There could be, especially when we start taking some public comments, I don't know if we divide and conquer or how all that will happen, depends upon how big that is, but we could potentially do meetings in between meetings and make it all via Zoom or something like that, but we'll cross that bridge when we get to it. Had put out that February 24th would be our next meeting, if enough of us can be available for that. It is, as far as the legislature, Connie furnished me with the session planner. Today is a pro forma day for those of you that haven't been around. That's basically, they took the day off, and so that's why it's so quiet here. Now, on the 24th, that's part of what they call turnaround. There'll be a big buzz going on here. The good thing is that these committee rooms will be open. There won't be too many, other than appropriations, basically, be the only committee that might be meeting on and off. So it'll be, I think it's good, when we can to meet here, because we can welcome any of the legislators that might have concern, or other, agency folks to join us. So we'll plan on the 24th, same time, and we'll see what room that they can make available to us. Yeah, 9 to 1, or I'm all, if it can be shorter, I'm all for short, but we'll kind of, reserve those times. Just FYI, I'm not proposing this, but just to think about it at some point, because we do represent the whole state, and of course I'm a little biased to Western Kansas. We might want to take to the road at some point in a year when we get our processes. It'd be nice to host a meeting at least once a year somewhere out west, like Dodge City or someplace else. So keep that in mind. And then the doodle poll, the best day that we have identified is the second Friday. Okay, so we have 8. So probably that's where we're going to go. We can finalize that, at February, but you might go ahead and just pencil that in. I don't know what the second Friday of March is.
And the only person who's indicated that they cannot make that work on that doodle poll was Lori, so you might want to chime in, Lori. And then we haven't heard from Mike K, or I don't think I have a response from you yet, Keith, either.
Second Friday of every month, is that what you're saying? I'm sorry.
Yeah, that's the second Friday of every month, Lori. So if that, I know you indicated that would be difficult, but maybe either via Zoom or at least some of the meetings could make that work.
My bad. Yes.
We'll put that in concrete in February. Right now we got February 24th, and I would say let's go ahead and plan on the second Friday of March, which would be the 10th. We'll get those on the book so everybody can put those on there. The 10th shows that they'll just be in regular session as far as the legislature. Goodness, we got through these last points so quick. I'm going to remind everybody to be pithy right from the start.
I have a question. Are you thinking the second Friday for the rest of the year going forward? I mean,
Yeah,
can we get that on our calendars?
We'll finalize that in February to see if there's, for whatever reason, but when to put that out, and at least for March, it'll be the second Friday, the 10th, and probably for the rest of the year, unless we find there's some unknown reason out there that won't work. Again, want to thanks to the staff, especially what's your name, sir? Jacob, Mr. IT, since I don't understand any of it, and, but sure appreciate it, and thank you for helping. Connie for keeping us between the lines, I guess, and for all of the board to travel out, and the people in the audience, thanks for joining us today and being part of the process for Sunflower. All the great work they've done so far. So if there's no further comment, we'll call for a motion to adjourn. Double motion. All in favor, aye? Okay, thank you.